Doctors, colleagues, frontliners, ladies and gentlemen, good evening. I am Madeha Medid, your host for tonight, welcoming you to the University of Visayas Graduate School of Health and Allied Professions, third Master of Science in Public Health, major in Hospital Administration's class, webinar on the updates of COVID-19 and insights on its vaccination entitled Bakuna sa COVID-19 Ating Alamin. Now, may we have a moment of silence for our speakers?
Bayang magiliw, pwes na silanganan, alab ng puso, sa litig mo'y buhay. Lupang linirang, duyan ka ng magiting, sa manlulupig, di ka pasisiin. Sa lagat at bundok, sa simoy at sa langit mong bakaw, may dilatang tula at awit sa paglayang minamahal. Ang isap ng mataw at may tagumpay na nagninig. Ang bituin at araw niya kailan pa may di magdidilim. Lupa at araw ng mahati pagsinta, tuwa'y langit sa piling mo. Aming ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
For tonight's webinar, the audio of your gadgets are purposely turned off to avoid interference during the session. You may drop your questions in the chat box and we will try to answer it after each speaker's discussion. We will also have an open forum after every speaker. We also have an evaluation or post-test after this, so make sure that you have to you complete this evaluation and post-test. For the program, call on the overall chairman, Dr. Hanifa P. Serosa, opening remarks.
So, a pleasant evening to everyone. First and foremost, I would like to thank our dear attendees for spending your time with us tonight in our first webinar conducted by our class in the Master of Science in Public Health, major in Hospital Administration. We would also like to acknowledge the presence of our professor, Dr. Rosny Coronado. Good evening, Doc. I hope that we will learn a lot from this webinar because these are very significant topics, very timely for those who are still undecided to be vaccinated or not. This is also very informative because our speakers are really experts when it comes to these topics. I hope that after the lecture, we will be more confident in convincing the people why vaccination is highly encouraged. So once again, thank you very much, dear participants. Welcome and good evening.
Thank you for that inspiring message, Dr. Sarasang. Without further ado, we will proceed with the first discussion updates on COVID-19. We will now call on Dr. Cheryl Chong Sabio to introduce our first guest speaker.
Good evening. It is my pleasure to introduce to you our speaker. She is a graduate of BS in Biology at Notre Dame University, Cotabato City, Doctor of Medicine at Our Lady of Fatima University, Valenzuela City. She had her residency training in internal medicine at Cotabato Regional and Medical Center and took her fellowship training in adult infectious diseases and tropical medicine in San Lazaro Hospital, Manila. She is currently an infectious disease specialist, a diplomate and fellow of the Philippine College of Physicians, diplomate and fellow of the Philippine Society of Microbiology and Infectious Diseases, and currently the chairperson of Infection Control Committee and HIV/AIDS Core Team Clinic and Treatment Hub. To give us more information and understanding regarding the COVID-19 vaccines and their importance, please help me welcome one of the busiest consultant today, Dr. Noraine Pendong Tansi.
Assalamualaikum. Good evening. Magandang gabi. Can you hear me?
Yes po,
Yes,
Doc.
we can hear you.
Maganda yung reception.
Yes po, Doc. Loud and
Okay, so good evening once again, and I would like to acknowledge the presence of Dr. Cornado. I think she is the one who is responsible for this presentation. Ano? I hope I will able to enlighten each and every one who have concerns or let us say agam-agam regarding the vaccines that we have, for particularly for the pandemic issue that we're experiencing as of the moment. So I hope that you will be able to learn something here. So I had a updated versions of my slides. So I hope you can, bear with the lengthy slides I have for tonight. So can you see my slides now?
Yes, Doc.
Okay.
Yes, Doc.
Okay. So for tonight, we're going to have a overview. Actually, it's not that overview, but it's a way for us to understand what a COVID-19 vaccines are. So since we are experiencing pandemic, so are we ready to embrace the new platforms of managing and preventing the current problems that we have? So these are my disclosures. So those who are with me for these past 3 years, I've been in Cotabato Regional Medical Centers. They already knew about my assignments in the hospital and other visiting consultations in the other hospitals. So these are the outlines for tonight's discussion. So medyo mahaba. Okay, so let us have a quick review of what is being currently facing the problem for COVID-19 infection. So a little bit of history. It was December 2019 in Wuhan, China. We heard about this, that there is a escalating cases of respiratory infection, which is unknown in the year 2019. But eventually, we're able to unfold the mystery of this infection. So it was caused by SARS-CoV-2, a family member of coronavirus. So if you can still recall, way back 2002 to 2003, the SARS-CoV-1 already emerged. So this is his or her sister from the family of coronavirus. So we able to name the infection as a COVID-19 infection, coronavirus infection that causing pulmonary infection way back 2019, kaya COVID-19 po siya. Okay, so moving forward, year 2020, we'll able to identify what are the management that can that we can give to these individuals who are being affected with COVID-19 infection. So the FDA approved the compassionate usage of these numerous treatments. One of these is the antivirals that we are from the management of this COVID-19 infection. So lucky enough, the Cotabato Regional Medical Center able to experience how to give the antivirals for compassionate use, such as the favipiravir and the remdesivir. And as well as we're able to identify what other supportive management and even strengthen how we can control or prevent the spreading of this notorious virus causing the COVID-19. So we're able to strengthen our infection prevention and control measures. And recently, we heard from different countries that they are releasing vaccines for COVID-19. So it is in the year 2021, it is officially been distributed, and the Food and Drug Authority or the agency, it is the one who is responsible to approve the release of these vaccines, particularly for SARS-CoV-2, controlling the COVID-19 infection. So, ang bilis ng pangyayari, 2019, 2020, and now we're talking about the vaccines for COVID-19 infection. So, what does the COVID-19 is caused of? So we already knew that it has been the SARS-CoV-2 is the etiology agent of this infection, and it has a major impact in humans according to World Health Organization. So it causes the following: the death and excess mortality among older and vulnerable population. It interrupts our daily activities, even our travels, no? Healthcare services, even our education. So the platform now is virtual. So yan na po yung new normal brought by this pandemic, no? And lastly, it also has a big impact, a negative impact in our physical and mental health, no? Maraming nagkakaroon ng depression because of this and the issue of the lockdown and so on and so forth. So we need to learn how is this virus affecting us. So we need to know how is the virus orchestrated, or how they are being infecting our body. So in mode of transmission, we already knew about it is being transmitted through inhalation, either by droplets or in an airborne transmission, especially in a closed room, no, in closed facility, or if you're doing aerosolized procedures, these viruses can, float around the air, no. So what are the parts? So this is a schematic diagram of a virus showing the parts of SARS-CoV-2. So you can see here is the spike protein. Important po ito sa pag-manufacture ng vaccine now, no? M protein, and as well as the RNA or the backbone of this SARS-CoV-2. So once the virus is being introduced to a certain person. So the virus uses this spike protein in order to attach to this ACE2 receptor. So importante po ito. So saan natin nakikita ang ACE2 receptors? In the different parts of the body, particularly in the respiratory system natin. As we all know, as what I have said, no, the mode of transmission is through inhalation. So pag na-inhale natin ito, napunta na sa katawan natin, particularly in our respiratory system, si virus, hahanapin niya si receptor niya kung saan siya mag-attach. And when it is being attached and enters to the cell, it fuses the cells, and there is a vesicle there that will embrace this virus, and the viruses or the virus fuses to the vesicle, and its RNA here, you can see here, it will release into the cytosol or the cytoplasm, and it will go into translation, translating the proteins. You know, RNA is made of proteins. So, translate niya yan, and then it will go to the next step. The virus will assemble again, and then once ready na siyang i-release, now you have a new virus now. So, next is, how is our body responding to this exposure to this virus? So that definitely, ano ang magiging fight back ni katawan? So what will we do, no? Kahit anong klase pa yan na foreign sa katawan ng isang tao, for example, this virus, bacteria, or even parasites, no? The immune response cascade multiple steps. So first thing to fight is, there is a group of cells that can, engulf these viruses. Once they are being engulfed, it will activate the cascading system or the cascading steps to fight back and produce our immune response. So what will the body system do? It will produce or release the B cell and T helper cells. The B cell is the responsible for the production of the antibodies, and the T cells for the killing of this, or cytotoxic killing or destroying these viruses that have been infecting the cells. So this immune response is the one that our vaccine nowadays and even before, no, this is the platform na gusto nilang gayahin. So why is it we're doing or producing the vaccine? Because we want to mimic the immune response. So ang gagawin ng vaccine na produce natin is, once they're been injected to us, ito na po yung step by step na gagawin niya. So in the actual setup, no, the immune response is, once the cells are being cascaded, the immune response are being cascaded, the B cells can take the memory. No, ibig sabihin, long-lived memory are being stored in the B cells, and the T cells, the one who are responsible for destruction. So once there is a new or true infection that comes in, so mare-recognize niya uli, and it will produce antibodies, and it will fight back, and it will control the infection, and as well as it will prevent cascading of complication from this infection. So yun yung gustong platform na gagayahin ng ating mga vaccine, itong immune response, that which is normally being experienced or being translated in our system. So next is for us to know, ano ba itong variants, no? SARS-CoV-2, when you say variants, marami siyang kamag-anak, marami siyang sister, brother in a family. So ganun natin siya i-approach. So ano bang kailangan yung malaman? Because SARS-CoV-2, it doesn't end as a SARS-CoV-2 alone. Marami yan siyang families, members. So sa family member ni COVID-2, marami siyang klase. Okay, so this is very much important in how do we approach the management and prevention of this COVID-19 infection brought by the SARS-CoV-2. So naturally, as you all know, no, ang virus, they change and mutate. Nag-iiba sila ng itsura once in a while. In a month or in a certain number of months, like for example, 3 months, no, pwede silang mag-replicate 2 to 3 times or more than that. Okay, normally, you have this structure and ang unang nagkakaroon ng mutation is the spike protein. Kasi nga, ito yung responsible to attach. Once this is being mutated, so the vaccines or any preventive measures, mahirap siyang eradicate. Kasi in time, they changes. That is normal reaction or normal response of the viruses. No? So, the potential for virus mutation increases. No? And the SARS-CoV-2 group tends to change more slowly than the other RNA viruses like the influenza viruses. So medyo mabagal sila. But still, they change as time goes by. These are the different variants that is being identified in humans. So marami nang nakaka-experience o nababasa na nila yung iba't ibang variants kamag-anak ni SARS-CoV-2. So meron siyang, first, it has been found, emerged in United Kingdom way back September 2020 and followed, ang bilis, nag-iba uli ang kanyang features. So we have a South African version or a variant. So what common in these variants are the way it is being transmitted is the same. They are being transmitted by respiratory or inhalational. But what a common denominator to them and even the previous variants, mabilis silang mag-transmit. Ibig sabihin, they could transfer from one individual to another. Okay? But in terms of, is this each variant ba may kanya-kanya silang degree of severity? So according to this table na it was emphasized by the CDC that the impact of severity of these different variants and in terms of the vaccine efficacy has no evidence or has no impact on the disease severity. Means to say, hindi ganun siya ka-serious or severe type. But when you encounter this, ang bilis nilang mag-mutate, mag-iba ng itsura, mabilis na makapanghawa. This is the reason why COVID-19 viruses or the virus itself has a variant. The highlighted words here is, as the virus mutates, their chance of survival increases. This is the main reason why they want to mutate, nag-iiba yung itsura in order to adapt to the environment. Kung alam nila paano sila namamatay o napiprevent na hindi sila mag-multiply, mag-transmit, magkakaroon sila ngayon ng idea how to adapt on the environment. So mag-iiba na rin yung kanilang means of survival. So nag-mutate sila, nag-iiba. So recently, we have a case, February 2021, out of 44 confirmed cases of COVID or the UK variant, tatlo ho dito ang from Mindanao. So it is in the region 11. So recently, as few days ago, nagkaroon naman ng South African variant. Among the variants, for all you know, that the South African variant, the B1351, is recently recognized as the most stubborn type of variants ng COVID-19. Ang bilis niyang mag-mutate, ang bilis niyang mag-transmit, mabilis siya makapanghawa. But how severe it is until now, it is unknown. So bringing the total cases of the South African variants in the Philippines country for 58. So medyo madami-dami na rin. So probably this is the reason why there is an increase cases of COVID-19 now in NCR kasi most of the South African variants are being identified in NCR area in Luzon. So next is, how do we define vaccine? So we need to define this one because this is the talk of the town now. So being a doctor or working in a hospital or clinic, kahit pa paano, at least even the definition of vaccine, we're able to know it. So it is a substance containing a virus or bacterium in a form that is not harmful. Remember, vaccine is not harmful. Given to a person in order to prevent them from getting the disease that the virus or bacterium causes. No? So, ibig sabihin, it is not harmful, and the purpose of having the vaccine is to prevent you from getting the severe form of the infection. It doesn't mean na nagbakuna ka, you're immune to everything. No, it is not 100% immunity, but it will prevent you from going to a more serious infection. Nagkakasakit pa rin tayo, ha? Hindi naman lahat perfect. So, pwede tayo magkasakit in a mild form or pwede kang mag-asymptomatic, no? But you are prevented not to go into a serious type or severe type of infection. So, you need also to know what does a vaccine compose of. So, it is composed of an antigen. Ito yung pinaka-importante sa lahat. Ito yung pinaka-main recipe. Eka nga, paano natin nabubuo ang vaccine? Kung wala si antigen, bakit pa tayo magbabakuna? Ano? So, antigen can be bacterial form. It can be a viral form. So, recently, we are talking about the COVID-19. So, ano yung main ingredient ni bakuna natin ngayon is the component or the whole part of the virus. So the one that is causing the infection, but in a killed or weakened form of antigen, or yung parte lang ng virus ang kinuha at nilagay sa vaccine na ito. So hindi mabubuo ang bakuna without the supporting ingredients such as the adjuvant, preservatives, stabilizers, surfactants, residuals, and diluent. Importante si adjuvant in order to secure the stability of this antigen na nilalagay natin, and to keep the virus or any component of the antigen that is mixed in the vaccine to secure the storage niya, no? Magiging stable siya, and then it will not be easily be destroyed, and can also stimulate the immune response in order to help this antigen, a part of the vaccine. So kasama ito siya sa mag-i-stimulate ng ating bakuna. Not all of the vaccines are using adjuvant. Okay, remember that? Hindi po lahat. But there are still the preservative and stabilizers, surfactants, and other ingredients are also important. Not necessarily na kung wala si adjuvant, di na maging effect at hindi na magpo-produce ng immune response natin. Still, kasi nandiyan pa rin yung antigen. So it will also induce immune response. And according to WHO, the World Health Organization, that they certify that all the ingredients are tested for safety. So meron tayong questions, no? Especially in the Islam believers. So according to British Board of Scholars and Imams, way back December 2020, they examine and check all the ingredients or the materials being mixed and used for vaccine formulation. So they check kung meron bang gelatin, because as we all know, gelatin, recently the gelatin is from pork products, no? So they testify that all the currently approved COVID-19 vaccine doesn't contain gelatin or any animal products. And also in terms of fetal cells usage daw, accordingly, currently available COVID-19 vaccines neither contain nor have been produced using fetal cell lines, according to them. Okay, so this is the composition of each of the recently approved FDA with EUA approval vaccines for COVID-19 infection. You have the AstraZeneca, the BioNTech, and the Moderna. So AstraZeneca is from Europe as well, combination ng European. And then BioNTech from States, and Moderna as well. So these are the components. So ano ang special attention dito? For AstraZeneca, BioNTech, and Moderna, they contain the chemical known as the polysorbate 80 for AstraZeneca, PEG glycol for BioNTech, Pfizer, and as well as Moderna. Those chemicals are highly inducible for allergic reactions based on the trials they conducted. Okay. So all of you are reading the literatures of these different platforms of vaccines that we are recently using. So sinasabi doon yung vaccine efficacy. So ano bang ibig sabihin ni vaccine efficacy versus vaccine effectiveness? When you say efficacy, this is the reduction in the disease due to receiving the vaccination. And ano yung nagiging outcome after you receive the vaccines is the effectiveness. So saan natin usually nakikita ito? The efficacy is being tested or being carried out in a controlled conditions, the ideal setup. While the effectiveness, nakikita natin ito sa real world. What is the outcome? After natin magbigay in a community, ano ba ang nakikita natin sa kanila? And sometimes they have different scenario benefit. Yung isa, efficacy, since it is in a controlled setup, best case natin. Best natin nakikita yung yung efficacy niya. But the effectiveness sometimes kasi nga, this is only an observational study. Sometimes you can get a worst case. So vaccine effectiveness often lower than the vaccine efficacy. So, ulit-ulit kung sinasabi yung efficacy. So, let us give a sample para maintindihan nyo what does the efficacy mean. So, you always reading a number and a percentage. For example, a 95% efficacy, what does it mean? So if you have a 90% efficacy, roughly means a vaccinated person has a 95% reduced risk of becoming sick compared to a person who doesn't receive any vaccine at all. So kaya nakita nyo 100%, so he has a 100% reduction to risk of becoming sick, like for becoming a moderate to severe type of infection. Okay, so yun po yung ibig sabihin ng mga number na yan na may percentage, anong equivalent niya to say na this the meaning for the efficacy. Okay, so 95% chance to reduce and you have only 5% to be sick or to become severe or in mild. So mataas pa rin. Okay? So if you're going to measure this ability of the vaccine to elicit immune response, so as we know it as a immunogenicity, ganito ang magiging itsura. So comparing these two diagram, okay, yung dito sa letter A is the regular infection that you are experiencing without the aid of vaccine. And the letter B is those with exposed to vaccination. So ang aim natin with the immunogenicity, the aim of the vaccine is to achieve this immunogenicity. Okay, maparami yung ating antibodies to protect us from the future infection or succeeding infections pa. So if you are normally infected without the aid of vaccine, naturally you could produce antibodies, you have your T cells to protect you. And in time, no, magpuproduce ka ng antibodies. So ito yung natural phenomenon. But if you already have a vaccine here, your body is being primed to protect yourselves once you have a true infection. So your body is already can recognize this infection and eventually it will protect you and prevent you from going into a more serious type of infection. Okay, serious type of the disease. So nandiyan pa rin yung ating antibodies to protect us. Okay, so ito yung gustong mangyari ng mga bakuna natin ngayon to elicit a more measurable immune response. Okay, ito na yung malalaman natin kung nag-develop tayo ng antibodies, how long will these antibodies will stay in our body and to protect us. So ito yung gusto nilang ma-achieve. And we hope in the future we're able to do this in the country because some of the countries who are, with a hybrid laboratories, so they're able to measure this, but still the process is need to be furtherly studied. Okay, so how vaccine works? Simply, it's safely delivers immunogen in order to elicit immune response. So vaccines greatly reduce the risk of infection by training our body. So tinitrain niya na once the body is recognize a true infection, the prime immune system that can produce antibodies against this antigen is now ready to fight these pathogens. So either it is viruses ba or bacteria. So yun ang main purpose niya. So in order to furtherly explain to you, ganito yun. We have a schematic diagram. You are being injected by a weakened form or killed form of vaccine that has a either virus or bacterial, or more oftenly, ang ating mga bakuna kasi is made up of antigen with virus. So weakened form, ini-inject sa atin, then ang katawan natin is napaprime. Ito yung mga panahon na wala pa tayong sakit. So once you have vaccinated and your body is being primed to produce these certain antibodies to fight this infection. So in the future, if ever you will be exposed to this type of viruses or bacteria, your trained immune system easily recognize these certain antibodies, no? This antigen. So your antibodies can catch them and destroy them as much as possible and as soon as possible in order to prevent complication, prevent the development, the more severe type of infection. So yun yung how our vaccines work. So generally, vaccines trains or primes our body in order to fight germs, either viruses or bacteria. So let us go now to the different groups of vaccine platforms. Ibig sabihin ito yung mga iba't ibang types ng vaccine na meron tayo ngayon in this 20th century. So we have two major types of vaccines. They can be either component type or the whole vaccines. Sabihin yung buong virus in-incorporate or kasama doon sa vaccine. Dito naman sa component, some of the parts lang nung virus ang kinuha lang nila. No? Parte, like for example, the spike protein, the RNA, DNA form nila. So yan lang po yung kinuha nila. Plus the other ingredients to make these viruses. Yung isa naman, buo. Okay, dito tayo mauna sa buo kasi konti lang sila. So the whole vaccines can be either inactivated or live attenuated. Nowadays, we have different types of inactivated and live attenuated vaccines that we are currently using. Live attenuated, ang common sample natin is yung mga MMR vaccines na nire-receive ng mga pediatrics population. And ang inactivated natin, meron tayong isang sample dyan is the flu vaccine inactivated form or the pneumococcal vaccines. Okay, some of you already received this. So doon, ito yung kanilang group. Okay, for these inactivated, the mechanism of action is they kill the inactivated antigen here is a killed type pathogen that is being included in the vaccine ingredients. So this killed pathogen cannot replicate itself. Ibig sabihin, hindi siya mag-produce. Once na in-inject yan sa tao, hindi siya magre-replika sa katawan ng tao. Hindi siya dadami and it will not cause any diseases. Okay? While the live attenuated naman, buhay siya pero pinahinang klase ng virus na inilagay doon sa ingredients ng vaccine. So you can see here below, below of these types of vaccines, nandiyan po yung mga brands or companies who produces this type of vaccines. Inactivated, recently here in the Philippines, na ngayon na ginagamit natin is the Sinovac. For live attenuated is the Codagenix. Okay, let us go to component vaccines. Marami sila, 6. So yung una is protein subunit. Some part of the protein from the pathogen only, or like this one, the spike proteins, you use this. This has been placed in the vaccine formulation. So ang unang gumamit nito or still ongoing na gumagamit ng ganitong platform is the Novavax and Sanofi. While the virus particles, like particles, proteins that mimic the pathogen itself, pero hindi naman daw siya buong pathogens. Very much different with this whole vaccine, no? protein-like lang yan sila na virus-like particles, okay? Medicago naman ang brand. And then DNA and RNA based. So this is a new technology that uses the blueprints of the virus particular. So the genetic material from the pathogen only. So you have the double-stranded and the single-stranded. So double-stranded using the brands are being still on the process is the Agnes and the Sidus. The RNA naman is the popular Pfizer and Moderna. So they uses this RNA base. So mode of mechanism nila is, mode of action nila is the RNA is being mixed with the vaccine and that is injected to the body. And then RNA now translate immediately. Hindi na kailangan mag-assemble, what you call this, magpa-process pa ng matagal. Kasi pure protein na po from the backbone of the virus are being injected to us and is easily recognized by the body and can cause immune response and the antibodies are being produced. Okay. Next is the non-replicating and the replicating type. So they uses a viral vector. Ito yung mga viral vector na type naman ng vaccine. So they using a carrier. No? What are the common carriers na ginagamit as a vector? Parang sasakyan sila ng component ni SARS-CoV-2, inilagay sila doon sa virus na ito known as the chimpanzee adenovirus 26. So this virus is killed type, na hindi kayang mag-replicate at mag-cause ng sakit sa isang tao. Okay? So yung isa non-replicating, yung isa replicating. So yung non-replicating, ang common na gumagamit dito is the brand name Kamalea or known as the Sputnik, AstraZeneca, and the Janssen or the Johnson & Johnson. So replicating another virus that can copy itself carries the pathogens, but again it will not cause infection to human accordingly to the trials that they have. So MSD and Pasteur and Institute ang gumagamit ng platform na ito. So what we have now in the Philippines, we had a FDA approval already, is the RNA-based component vaccines and the non-replicating viral vector vaccines. And the next one is the inactivated. So anong common dito is sa atin ngayon is the Astra and the Sinovac. What I mean is nandito na sa Philippines, but still the Pfizer which already have the FDA EUA approval in the Philippines but is still not yet available in the Philippines because of some issues. So current scenario natin is we're in the middle of the pandemic. So we are observing minimum health standards. So the question is this enough to mitigate the problem? Probably 50% enough for the minimum health standard observation. But having a natural immunity is not enough as well. So what we need is a much bigger producing immunity, what they call the herd immunity. Like what we did in way back, mga 19,100s pa, smallpox infection, eliminate by using this platform. Okay? So herd immunity, also known as a population immunity. So means to say this is an indirect protection from infectious diseases that happens when a population is immune either through vaccination or immunity development through previous infection. So yung immunity or known as the previous infection known as the natural immunity, napakabagal. But anong pinakamabilis na makaproduce tayo ng immunity? Mabilis mag-produce ang ating immune system. Immune response is through vaccination. So the acquired immunity can be, as what I've said, can be natural or by means of immunization. And the goal of these two is to protect when getting exposed again to the same pathogen and prevents them from spreading. Okay? So mabilis natin ma-achieve yung herd immunity is by means of vaccination. Okay? So meron tayong scenario dito for you to easily understand, grasp what does the herd immunity. Ito yung isa sa goal Aside sa immunogenicity, goal ng vaccine is to have a herd immunity. Okay, we have different scenarios here. You have here person who is still healthy, not immunized. The yellow one is the immunized and healthy individuals, and the red is the one who is sick. So you have here a first scenario, maraming healthy individuals, walang nag-vaccinate. But when you put two sick individuals there, walang immunization, so what would they do? The contagious, it will give us a contagious spread of disease throughout the population. So kukonti lang ang makakapag-protect sa kanilang sarili through natural immunity. Okay? Or since healthy individuals sila, hindi sila kaagad-agad na kakasakit. So kukonti lang sila. But still, outnumber sila ng may sakit. Next, those who are vaccinated, kukonti, and then still there is a immunized, healthy individuals na hindi nagpa-immunize. You put two sick individuals, what will happen? Some of the population get immunized, okay, but still continues to spread the infection. And only few people again can develop natural immunity. And these individuals are minimal, who are less, only a few numbers of them protect themselves, but still all the other vulnerable individuals still be infected. For the last scenario, this is our main target, is marami pong mababakunahan, and then yung iba, siyempre, healthy pa rin. And if you put an individual there who are sick and they are being exposed, so for those who immunize, they can protect themselves. Possibly, meron pa silang mararamdaman, but in a less severe type, and still they can mount immunity, can still produce immune response, and hindi na po magmumultiply yung merong may sakit. Kung meron man silang mahawaan, very minimal or less number. Because lots of individuals here who are already protected, and they have the less chance to experience severe type of infection, and some of them will not be infected. So, ito yung beauty ng pag tayo ay nagpabakuna. Maraming mapoproteksyonan, even our loved ones who are vulnerable to this kind of infection. So, are the COVID-19 vaccine needed? Yes, definitely, because vaccine offers one of the best ways to end this battle against COVID-19 pandemic. So next, let us define the reactogenic and the allergic reaction. So February 1, 2021, this this society where I belong as well, doon sa PCP, with a position statement from the PCP and from the Philippine Society of Allergy, Asthma, and Immunology on COVID-19 vaccines and their adverse reactions. So they define there in statement number 1 that reactogenic reaction is not the same with allergic reaction. Kasi nga daw, ang reactogenic reaction is an inflammatory response lang. Okay? Kung ano yung pagbigay sa'yo, the way it is being given to you, the vaccine, kung ano ang naging ang immediate reaction mo doon, like for example, swelling, no, in pain, yun ay tinatawag nating inflammatory response, and that is our reaction to this substance that being injected to us. How about allergy or hypersensitivity reaction? This is an exaggerated immune response natin to a usually harmless substance. Ito yung tinatawag nila, nagkakaroon ka ng anaphylactic shock or anaphylaxis, no? So, these two is very much different. So, yung isa, inflammatory response. Yung isa naman, exaggerated response to a usually harmless substance. So, hindi ho sila pareho. Okay? Pag may nagtanong sa'yo, yung allergic reaction ba is pareho kay reactogenic? Hindi po. Very much different. So this is a schematic diagram that explains to you the reactogenicity, a subset of reactions occurring soon after receiving the vaccine, local stimulation, immune cell recruitment that causing the swelling, and some feels the symptoms are headache, fever, and fatigue. So more or less physical manifestation po sila brought by the inflammatory response from the vaccine. So let us go now to the COVID-19 vaccines available in the Philippines. So I have here a recent SARS-CoV-2 vaccine tracker made by the Philippine Society of Microbiology and Infectious Diseases. So they made a table for the vaccine who already have the phase 3 clinical trials. So we already have the Pfizer, Zeneca, and CoronaVac based on the FDA approval, no, and EUA approval they give to this vaccine or these companies who produce this vaccine. So you can see here that characteristics of the different vaccines. So ang main or major discussion for these three check vaccines that were already in the Philippines is the AstraZeneca and the CoronaVac or the Sinovac. Okay, we will talk this in detail. So you have here the adverse events. If you want to read on this, you can check this on the website of Philippine Society of Microbiology and Infectious Diseases. So technically, hindi naman natin kaagad nare-receive ng ora-orada ang bakuna. So meron po tayong responsible agency who will scrutinize and check these vaccines are already available in different countries. So who are those responsible? Are from the Agency of Food and Drugs Authority that they give their approval. They are the one who grants the Emergency Utilization Authority. So they are responsible to grant this utilization of these vaccines. So how a new vaccine is being developed and approved and manufactured. So hindi po natin pagkabili ni gobyerno, pagbigay po ni WHO, gagamitin na natin. So dadaan pa po yan sa proseso. So what is being allowed is if this vaccine is able to reach the phase 3 clinical trial. So you have here a description. So normally, we have different phases. Marami pong phases, no, of clinical trials. So we have the preclinical trial, phase 1, phase 2, phase 3, phase 4. So sa preclinical trial po, yan po yung ginagamit muna chine-check muna sa mga low forms of animals. Okay? So pag pumasa ho doon, lalo na yung ingredients na kailangan, safety measures, saka ho nila binibigay na po, pina-forward na po at nag-step 1 na po sila sa phase 1, phase 2, and phase 3. So when you have the phase 1, they uses 100 healthy volunteers. Chine-check ho nila dito yung safety. No? That's how this vaccine works and may mga side effects ba. So few number of healthy individuals ang chine-check nila sa phase 1. So napagdaanan na ho ito ng mga bakuna na meron tayo. So phase 2 naman, ginagamit na nila sa mahigit 100 volunteers, healthy individuals. So dito natin makikita kung ano yung most common short-term side effects. And ano yung mga immune response na mga nabakunahan na ito. Next is ilalagay na nila sa mas marami pang healthy individuals who volunteered to be inoculated with these vaccines. So anong ginagawa nila dito is how do people who get the vaccine and people who do not get the vaccine compare? So pinapa-compare nila yung may placebo at saka yung tinatawag nating control at saka with those who are vaccinated. So chine-check nila again yung safety and efficacy, no? And chine-check din kung may mga most common side effects ba silang makukuha. So technically, ang ginagawa ng FDA is chine-check nila ito kung lahat ba ng pumapasok na bakuna sa atin is dumaan sa mga prosesong ito. And since we are in the pandemic, since mahaba yung proseso ng paggawa ng vaccines, it takes 5 to 10 years. Ito, for this group of vaccines, they able to achieve some of them in a span of 18 months. So mas shorter pa doon. So FDA licensed those vaccine if they are safe and effective and benefits outweighs the risk for the usage of this vaccine. So hindi pa ho nagtatapos dyan. Kailangan ma-achieve pa ng mga manufacturers ang emergency use authorization in order to expedite the production and usage. But able to met the available quality, safety, and efficacy performance data. Kailangan dumaan ho sila. Once they're able to pass through this, all the examinations, the criteria for the expediting the production of these vaccines, they're able to receive this emergency use authorization. So in the Philippines, we prioritize individuals who will going to receive these vaccines. So sa Group A, kasama po ang frontliners. So kaya po, hindi ko nakapagtataka na nauna po tayo. Kasi ginro po tayo, nandito tayo sa Group A. So we belong to Group A1. So either public or private who are directly handling or exposed to these COVID-19 individuals infected with SARS-CoV-2. After that, we will give the indigent senior citizen, remaining senior citizens, and remaining indigent population and uniform individuals or the one who is next in line. So kailangan matapos muna natin ito. Maybe roughly by May, we'll be able to finish the phase 1 for the A1 group. Then susunod na po, June onwards until December, is ito mga other groups of priority eligible for COVID-19 vaccination. So this is a summary of the vaccine prioritizations. We have 6 phase. So we have prioritization group, the A, B, and C. So yung Group C po, dito po belong yung mga remaining population na hindi po kasama dito. And the B is the phase 5 for other frontline workers and special population. Dito po pasok yung mga teachers or nasa business. So yan po sila. So ang una natin ngayong ginagawa is nasa phase 1 na ho tayo. So in May or later April, we're able to finish this. And we're able to target the 2021 50 to 70 million Filipinos should be vaccinated. So ito yung goal po natin, target. So in time, bago matapos yung 2021, marami na pong mababakunahan. So let us go now to the currently available vaccines that we have. So first, ito po yung naunang dumating. It's not just because malakas ito kay Presidente, hindi. Nauna lang po sila dumating. No, naunahan lang po yung ibang approved na bakuna. So let us first have the CoronaVac for you to know the profile of the CoronaVac Sinovac produced vaccine. So in terms of ingredients, as what I have shown to you a while ago, may mga kailangan po na ingredients ang isang bakuna. So in Indonesia, President Widodo instructed the staff or the agency to regarding the vaccine, coming vaccines to them. So chinek ho nila yung bakuna from China, which is the Sinovac, if this is halal or not. Kasi issue po ito sa Islam believers na dapat halal po yung kanilang mari-receive na bakuna. It doesn't contain any animal products. It doesn't contain any fetal content, fetal cells content. So when they check these Sinovac ingredients and the manufacturers in China, so they certified this that it is halal. So first vaccine certified as halal among the vaccines who already have the FDA approval from other different countries. Okay, so nakita nyo, first dose po ito ni President Widodo. So mechanism of action for the Sinovac vaccine, it can produce immunity. Ito po yung goal ng lahat ng bakuna, and as well as prevent the disease caused by the SARS-CoV-2, and they could produce neutralizing antibodies, okay, for fighting the SARS-CoV-2 virus. So this is the profile. So they are inactivated type of virus vaccine. They use as adjuvant the aluminum hydroxide. The total doses that should be received is 2 doses. You have the day 0 and the day 28, so meaning 28 days interval po. So on the injection day, that is the day 0. So after the day you're being injected, that is day 1. Hanggang ma-reach nyo po yung day 28. And it is being given intramuscularly, particularly in your arm, the deltoid, the non-dominant deltoid arm nyo po. Dapat dun po kayo nagpa-inject. So para wala ho tayo maging problem during your physical activities. So it is stored in +2 to +8. So hindi masyadong maarte ang storage ng Sinovac. And in terms of preparation, once you receive it, you do not need to mix. You just aspirate this and you give it immediately to those vaccinee. And you do not need to freeze them. So you just need to aspirate, administer it immediately after opening. Para ho yung potency, yung lakas, stability and efficiency ng yung bakuna is very much preserved and effective immediately. So it is already been FDA approved. Syempre, sa US and UK, hindi pa po yan. So we use a vial form, no, na Sinovac. Yan po na-receive ng Philippines. Sa other countries, medyo mahal kasi ito, pre-filled syringe na po. Dala-dala na ho niya yung syringe. But for the vial, the Department of Health prepared syringes for these vials. Para standard po yung gamit. Okay. So Sinovac as well, they conducted in different countries, the Brazil, Turkey, and Indonesia. So they passed the phase 3 trial and they used this in a healthy individuals, so healthy adults ranging from 18 to 59. This is the reason why, kaya po ito recommended lang because of based on the trials details na ginawa ng Sinovac. And as well as healthcare professionals 60-year-old and above. Pero dito nila nakita na may good response, maganda ang efficacy sa mga healthy individuals, age ranging from this one. So I have here a table showing you the precautions and contraindications that you need to take note of it. And in terms of reactogenicity and adverse events following immunization. So you have local and systemic symptoms. Siyempre, ang most common pa rin po, very common, is the pain on the injection site. For the precautions naman, so we have a insufficient data for 60 years old and above. Patient with diabetes, convulsion, epilepsy, encephalopathy, mental illness, and family history of these conditions, precautions po. Pwede pong ibigay pero kailangan lang ho natin silang tututukan, and then we will ask for their medical clearance prior giving this vaccine because yun nga insufficient pa ho yung data. And those with thrombocytopenia, hemorrhagic diseases, and kasi baka ho may maka-experience ho ng bleeding during the inoculation. And the contraindication for this Sinovac type or the corona vaccine from Sinovac, number 1 pa rin po is the allergic history reaction to any component of the vaccine or similar vaccines. Especially this is being notified after the first injection or the first dose. Okay, pag meron tayong allergic history, rashes, means to say sa second dose nyo, hindi na ho kayo makakakuha. Kasi meron na ho tayong nakuhang history ninyo na kayo ay nagkaroon ng reaction. Previous severe allergic reaction to the vaccine, again, hindi din po kayo makakakuha for your second dose. For those individual with neurologic conditions, transverse myelitis, GBS, demyelinating diseases, contraindicated po sila, and those who with uncontrolled severe chronic diseases. No, hindi pa rin po. Lalo na yung mga newly diagnosed, nasa hospital, and then yung hindi control ang kanilang mga, like for example, ang taas ng HbA1c, nag-hyperthyroid storm sila, I see, no? Yung mga ganong circumstances, then currently on initiation of dialysis, so definitely hindi po muna natin sila bibigyan. Even though this is a inactivated or killed form type of vaccine. For us to prevent complications from receiving the vaccine. And lastly, pregnant and lactating women. So there is a condition here, no, for pregnant and lactating women who are in the healthcare worker group, no. So still, you need to have clearance from your OB. We need to ask for the clearance if your OB or your OB-GYN will allow you, because it is based on the profile, it is contraindicated. But you should think of weighing out the risk, no? It will protect you, but it will give you something. Like, pwede kayong magkaroon ng reaction. But all of these reactions based on the trials conducted are all mild. Okay? If you really want to be vaccinated, again, kung kahit ano pa pong bakuna yan, you need to have a check up first and have a clearance from your attending physicians. So last week, the DOH gave a summary of the consideration for the Sinovac allocation based on this data. So it is only been provided to 18 to 59-year-old, healthy population, not including the pregnant and lactating women, not recommended for those who are healthcare workers with direct exposure to COVID-19, but it is not contraindicated. So we will lighten up this later, ha? Masyado kayo mag-clamor dito sa portion na to, no? I will give you a explanation to this one, and maybe you could think about it if you are being enlightened with this one. So senior citizens are not allowed, but if you are a healthcare worker and if you really want to be injected, again, clearance lang po from your attending physician if you have comorbidities. Speaking of comorbidities, not recommended, but again, it is not contraindicated. Again, you need to weigh your risk, okay? The benefit outweighs the risk lagi. So, clearance po and syempre your consent. And again, it is 2 doses given, day 0 and 28. Intramuscular, your deltoid, the non-dominant, and it is 0.5 ml. Again, for every vials that you will receive, that is only for one individual. For one person lang po. Hindi nyo pwedeng i-share sa iba. So, isang vial, isang tao lang. For any excess, excess of the usage of these donated vaccines, it will be granted and given to A4 frontline health essential workers. Yun po yung mga uniform men. Bibigay po natin sa kanila. So in summary, COVID-19 vaccination for healthcare worker, particularly in Sinovac, is not mandatory. If you're not able to receive your share of Sinovac, still you're not been removed to your priority list. Kasama pa rin kayo for the future vaccination. Nasa priority A1 pa rin kayo. So for the efficacy data, comparing the two who are recently here in the Philippines, so platform for Sinovac is inactivated type. AstraZeneca is a non-replicating viral vector. It uses adenovirus 26 from the chimpanzee. Safety profile, local reactions po ang na-document sa Sinovac. And for AstraZeneca, may content po sila ng polyethyl glycol, polysorbate, which can also cause local reaction or in a severe type. Depende po sa ano po magiging response ng isang vaccine. Efficacy data, you can see here they have similarities for preventing severe type, 100%, 100%. So this has been based on the study conducted in Indonesia and Turkey. And these two are already EUA approved for this group of individuals, 18 to 59, 18-year-old and above, including the seniors. Okay. Much awaited AstraZeneca. This will be rolled out for us next week, starting Tuesday up to the following Monday. So 1 week po rin. Kapareho ng Sinovac, 1 week po rin yung roll out for CRMC and other hospitals and allied forces from the healthcare worker A1 group. So what COVID-19 vaccine for SARS-CoV-2 per se, what is its use? So it simulates the body's natural defense. It causes the body to produce its own protection by producing antibodies against this COVID-19 in the future. So none of the ingredients of this vaccine can cause COVID-19 infection. Kasi nga, meron siyang carrier na chimpanzee adenovirus 26. Doon ho nilalagay, sinisiksik si component ni SARS-CoV-2. As with any vaccine, COVID-19 vaccine for AstraZeneca per se may not protect everyone or for all of the vaccines. May not protect everyone who is vaccinated from COVID-19. Kasi nga, as what I've said, hindi po perfect yung vaccine. Pwede pa rin tayong magkasakit. But we're preventing to become more severe type. Okay? It's not yet known how long people will who receive the vaccine will be protected for any vaccine. Ganito po rin po yung sinasabi, no, based on the clinical trial. So kaya po continuous po ang ating follow-up for these individuals who will be vaccinated. So for these vaccines, no, either Astra or Sinovac, until 1 year po yung monitoring sa bawat isa. So mechanism of actions like with the Sinovac, the only difference within the two, kasi nga ito ay non-replicating type. So monovalent vaccine composed of single recombinant replicating deficient chimpanzee adenovirus. So, ibig sabihin wala siyang kakayahan mag-replika, mag-produce ng viruses ni adeno sa katawan ng isang tao once this has been injected. They are the one who can encoding the glycoprotein of SARS-CoV-2. So, yun nga, carrier lang sila. So, following the administration, the S-glycoprotein is being injected and carried by the adenovirus once it is been sensed or detected by our body, it can express local stimulating neutralizing antibodies. So mapuproduce siya. And eventually, it also causes cellular immune responses. Kaya meron tayong tinatawag na what you call this? Allergic reaction in the future. So I'm not saying na lahat ng in-inject ni ni AstraZeneca ay magkakaroon ng anaphylactic shock, allergic reaction. Hindi po. For every individual, may kanya-kanya pong reaction. This is only will tell us, no, sinasabi namin ito for you to be prepared of and be knowledgeable of what will you expect on these different platforms of vaccines. Maliwanag po yun, no? So, profile for the AstraZeneca, again, non-replicating type, chimpanzee adenovirus vector type of vaccine. Ito po yung bakuna na walang adjuvant na kailangan kasi nga po nandun na po yung glycoprotein doon sa loob ni chimpanzee adenovirus. And again, we will receive this as 2 doses, 6 to 12 weeks interval. But for the Philippines, according to the kanina po na meeting namin with the debriefing for the AstraZeneca, the interval that we will use is 28 days. Same with the Sinovac. Maliwanag po, 28 days. So day 0 and day 28. Yun po yung gagamitin natin. Even though, ang kanyang profile can be up to 12 weeks interval. So route administration, pareho din po, deltoid, intramuscular, non-dominant arm. So in terms of storage, 2 years at negative 20 degrees, pwede natin siyang itago o i-keep. Then kung 2 to 8 plus po na degrees, until 3 months po, pwede natin siyang i-keep. So ang preparation, mamaya i-detail ko sa inyo kasi according to this, way back January, no, or February, late February, ang sabi nila, walang special preparation. But later, I will explain to you. So, ito na. Preparation and handling based on the Department Memorandum 2021-0123. Ito po yung instructions. The vaccine shall be inspected visually prior to administration and discarded if particulate matter or differences in the described appearance are observed. So, dapat po kasi color white. And ito, sa Sinovac, you don't need to shake. Wala kayong iba masyadong effort na gagawin. But this one, please bear in mind, do not shake the vial. Once the vial has been opened, first needle puncture, it shall be handled according to the WHO vial policy and be discarded at the end of each immunization session or within 6 hours after opening and needle puncturing the vaccine, whichever comes first. So within this period, the product shall be kept and used at temperature up to 30 degrees Celsius. Kaya po meron tayo mga pharmacy refrigerator for every vaccination site, particularly in Cotabato Regional, meron po kami niyan. So, ito po yung preparation. Kailangan hindi natin siya i-shake. And then, once nagamit na ho natin at na-open yan, 6 hours lang po. It's just the same with Moderna and Pfizer vaccines. Medyo maarte sila. So, once na-use, 6 hours lang po, timer, wala na. So, kailangan po, once you have scheduled for AstraZeneca, please follow your schedule. Kasi po, limited din po itong stocks natin and kung ilan po yung dineclare ng per vaccination site, yun lang po yung ibibigay ni DOH. And then wala ho tayong buffer for every mistakes. Nagkamali tayo, wala ho tayong pampalit. Okay? So wala ho tayong buffer. So very, kung po ito sila, sensitive type. So AstraZeneca, these are the studies conducted, no, na dumaan na rin po sa phase 3. So according to the efficacy data here, 70.4% for 14 days after the second dose. Based on the current studies conducted by these individuals, na the longer the interval, no, it increases the efficacy. Kaya ho pinili natin yung 28 days. Okay? Injection site pain and tenderness, fatigue, headache, feverish, myalgia, these are the common reactogenicity or adverse events data gathered during the trial conducted. So precautions, contraindication based on this trial is wala daw po. So I will again show to you what are the precautions and contraindication based on the memorandum. So this is how the platform of vaccine trial for Oxford for the AstraZeneca. So they produce using the adenovirus, the glycoprotein from the SARS-CoV-2 being inserted to this carrier, and then it's been added to the vaccine, and that is injected to humans. So this vaccine intended to produce antibodies, and then in time na merong true infection, it can protect and prevent us from having the disease. So this is the current advisory from the Department of Health, Region 12. So the department the advisory tells us that for immunization, for using the AstraZeneca, the vaccination shall commence starting on March 16 that ends on March 22. And these are the targeted recipients for AstraZeneca. Number 1 is healthcare workers from the 23 COVID-19 referral hospitals. Yan po sa taas, marami po sila. So, letter A from this group are healthcare workers who are senior citizen, healthcare workers who deferred from the Sinovac immunization, and those who are healthcare workers who refuse to be inoculated with Sinovac. So, pwede pa rin ho kayo dito. And all healthcare workers from all public and private, pwedeng infirmary, level 1, 2, 3, health facilities na hindi ho nasama sa unang rollout po ng vaccine. So sila po ang isa sa mga recipient po ni AstraZeneca. So AstraZeneca profile, detail po. They use, for every vial, we use this as a multi-dosing injection. So, hindi ko katulad ni Sinovac, 1 vial, 1 person. Ito po, sa isang vial, multi-dosing. So, meron siyang 5 ml, pwede po tayo makapagbigay ng, makagamit sa isang vial ng up to 10 person. So, 0.5 ml lang kasi yung gagamitin nila. So, recombinant, replication deficient, if chimpanzee adenovirus vector encoding vaccines, encoding for glycoprotein. It is produced genetically modified human embryonic kidney. 293 cells are being used, and it contains genetically modified organisms. So, ibig sabihin, after you will inject, kailangan po, you will do your infection prevention measures. So, every handling for every vaccine is, kailangan po tayong hand hygiene, maglinis ng surface because this is a live modified organisms are being used for this type of vaccine. Kahit ano pong vaccine, every after you you do your vaccination, kailangan po naglilinis at ilagay po sa tamang receptacles ang mga gamit na gagamitin natin. So, the age group should be more than 18 years old. Kasama po ang seniors dito. The doses, as what I have mentioned, no? Ang interval na gagamitin natin is 28 days. Special population, ito na po. Ito po yung isa sa mga gusto nating i-emphasize, no? For elderly population, particularly for AstraZeneca, efficacy and safety data are currently limited, but in their profile, they can be given, no? So, individuals more than 65 years old of age. So, yung 18 and 60 above, may profile po sila na maganda ang efficacy. But for those more than 65, yun nga po, meron lang po silang sinabi dito na efficacy and safety data are currently limited. So meron pa rin sila nun, pero hindi ho ganun kadami yung population na nagamit nila. So no dosage adjustment is required for elderly population. Kung ano po yung nire-receive ni 18 years old, 0.5 ml, ganun din po kani elderly. Pediatrics, definitely, they are not included because of these studies. They didn't include 18 years old below. So contraindications because of the polysorbate 80 for those with history of allergic reaction. So contraindication, hypersensitivity to the active substance, the polysorbate 80, or to any of the excipient or recipients. So bawal po sila. Usually napapansin natin ito pag tapos na sila sa first dose and they experience rashes. So definitely on the second dose, wala. You will not give them their second dose. Special warnings and precaution for use. Ibig sabihin ng precaution, babantayan natin. Hindi po sila contraindicated, but we need to check on them. Okay? For hypersensitivity, kailangan po dapat i-document natin, no? Alamin, during your screening, talking to your clients or for your vaccinee. Concurrent illness, definitely. Sino po yung may sakit? On the day na iba-vaccinate sila, presence of minor infection, cold, low-grade fever should delay their vaccination. Okay? Any individuals who are suffering from acute severe febrile illness, 37.8 above, hindi ho natin muna sila bibigyan. We will delay them. Okay? Thrombocytopenic coagulation disorders. Still, they could receive, but we need to monitor them. And then if they are already documented having a history of this and their doctor is diagnosed them with this problem, please get first your clearance from your attending physician before you subject yourselves for vaccination. For neurological events, very rare events of demyelinating disorders have been reported following vaccination. But the causal relationship to the vaccine is not yet established. So as other vaccine, the benefits and potential risks of vaccinating individuals, again, should be considered and you should ask your attending physician to give you clearance to receive these vaccines. Immunocompromised, not known, but still they can have the vaccine provided their status is cleared or known and their attending physician allowed them to receive this vaccine. So those receiving immunosuppressant therapy, kailangan po yun, no? Like those in chemo, those who are HIV patient receiving their ARBs, no? For HIV individuals, no, kailangan po ma-reach po nila yung more than 20 cell units for their CD4, and they are religiously taking in their ARBs. Duration and level of protection still yet to be established, no? So hindi pa natin alam kung gaano katagal yung lifespan ng antibodies na mapuproduce from these vaccines. Interchangeability, hindi ho pwede na si Sinovac ka ngayon, bukas si AstraZeneca ka naman. Hindi po. Kung ano po yung na-receive natin na bakuna, it should be the same. Pregnant, limited amount of data. Pero based on this department memorandum, not recommended during the pregnancy. But if you are a healthcare worker, no, again, outweigh the potential risk. Okay, so clearance again to your attending physician. Breastfeeding, the same with the pregnant, no? Precautionary measures when having their, for breastfeeding. Fertility, still unknown. Kung may balak ko kayo magbuntis or may fertility problem, you can still receive your vaccine, but please coordinate first to your attending physician kung meron kayong fertility workup, no? Kung papayagan ho kayo. Kasi ang data is still unknown. Undesirable effects, these are very much important because most of us have the fear of this undesirable side effects kasi yan yung isa sa mga nagsasabi sa atin na medyo alanganin tayo sa pag-embrace ng vaccine na ito because of this issue. Yes, certainly the vaccines are not perfect, okay? They still have the side effects. So based on this memorandum, when compared with the first dose, adverse reactions reported after the second dose were milder and reported less frequently. Adverse reaction for those aged more than 65 are milder and less frequently reported. The majority of the adverse reactions were mild to moderate in severity and resolves in few days of vaccination. So some gives analgesic antipyretic like the paracetamol for the relief of their symptoms post-vaccination. So sa UK experience po, i-share ko sa inyo, recommended giving paracetamol 1 gram prior to administration, particularly with the AstraZeneca. I don't know anong rationale. Pero possible po, dahil po na-anticipate natin na masakit or baka magka-headache ka, para ka nag-prophylaxis. It depends upon individuals. Kung mataas naman po yung tolerance nyo sa pain, you cannot take this. It's only an experience from AstraZeneca, from from United Kingdom. So on this memorandum, meron pong table doon. If you're able to receive this memorandum, no, pwede niyo po ito i-Google, makikita niyo po yan. Based on the trial phase 3, these are the listed reactogenicity based on the AstraZeneca profile. So very common po yung injection site pain, followed by the tenderness, headache, muscle pain, you have joint pain, and nausea. Very common din po for those who given with AstraZeneca is yung feeling pagod, 53, masakit ang kasukasuan, 44, parang lalagnatin, 33.6%, yung nanginginig o nag-chills po, 31.9%. And among these, na-complain nila for those individuals who are being inoculated with AstraZeneca vaccine is feverish po for 7.9%. Okay? So, this is the summary, sharing to you the slides of my consultant, Ronjin Solante. Dr. Ronjin is our chairman in San Lazaro Adult Infectious Diseases Department. So he summarized the COVID-19 vaccines in terms of their overall efficacy, age bracket, especially for the elderly, preventing severe, efficacy versus new variants, and their side effects. So more oftenly, yung target natin with WHO threshold are all of these vaccine pass the criteria of the cutoff for 50% efficacy. So you have the 50% chance to reduce chance of to be infected and develop or to be sick by due to this SARS-CoV-2 virus causing severity. So 50% chance to be not to be infected and not to be on the severe form. So let us go to the common questions. So absolute contraindication po is allergy. Specifically, this can be experienced after the first vaccination. So yes, there's a side effect and more frequently after the second dose. No, I'm speaking in general for the vaccines. So based on the statement, allergy to previous dose of COVID-19 vaccines and any component is the only current contraindications. So these are the special attention ingredients of these vaccines. You can see them in the mRNA, the Pfizer and the Moderna for the PEG and non-replicating vector for Astra and Gamaleya or the Sputnik. They contain polysorbate 80. So, special groups who can receive the vaccine. So, for lahat ng vaccine, ito po yung ng COVID-19. If you have allergic reaction for any severity, so precautions po tayo, but still you can receive your bakuna. O kung allergic po tayo sa insects, allergen, latex, oral medication. So, once you declare your health problems, no, or you're allergic or past medical history, kasama po kayo sa babantayan. Okay? Patient with immunodeficiency and autoimmune problems, so they also get vaccinated, but they should be informed that there is still not enough data. So, as what I have shown to you, yung dalawang bakuna natin is limited pa rin po yung study output nila regarding these groups. And well-controlled asthma inhaled, using inhaled corticosteroids for the allergic rhinitis on intranasal, you can still receive the vaccine. So, hindi po kayo contraindicated. The more you need to receive your bakuna. So, how about those who with active COVID-19 infection? Definitely, hindi ho natin sila bigyan ng bakuna ura-urada. They need to have they need to recover from the COVID-19 infection. So, especially for those who are also receiving monoclonal antibodies and doon sa mga nag-transfuse ng plasma convalescent. So, ideally, after their infection, bigyan natin silang 3 months bago sila mabigyan ng bakuna. So, should person who had COVID-19 in the past still get vaccinated? Yes, definitely. They'll still be recommended to be given. Okay, kahit na nagkasakit sila, they still need to be given provided they're able to complete their quarantine isolation, prescribed isolation, and they are fully recovered. Okay? Naturally, the immunity from COVID-19 infection, the immunity, according to the studies from the WHO evaluation, it could last only 3 to 6 months. Kaya po, doon sa checklist na ginagamit po ng ating mga screeners sa vaccination site, meron ho doon tanong kung kailan ho sila last na infect, more than 90 days na ho ba? So if more than 90 days na nakumpleto na nila yung isolation nila, asymptomatic, recovered na sila, they can receive their vaccine. But longer periods still needed to be measured in terms of response to vaccine kasi nga until now, under study pa rin siya. So ito na po yung sinasabi ko kanina na ideal time to receive the COVID-19 vaccine after rotating to COVID-19 isolation facilities. Kasi nakalagay ko sa Sinovac, it is not recommended for those healthcare workers who are directly handling the COVID-19 in the isolation facility. So the answer is, depends on the scenario. First scenario is the healthcare worker screened with RT-PCR after the 5 days post-isolation rotation and the result is negative and they are symptomatic, they can be vaccinated. Next scenario, not screened, pero kinumpleto niya yung 14 days, post-rotation niya at asymptomatic, yes, pwede po natin silang bigyan. Kasi may mga isolation facility tayo na walang kakayahan mag-RT-PCR post-rotation. If despite the above scenario is undertaken, but the healthcare worker presented signs and symptoms of possible COVID-19, you need to defer their vaccination and you need to test them with RT-PCR. Kasi baka naman talagang nagkaroon sila ng sakit. Okay? So yan po yung scenario. Please take note of this para hindi na tayo malito. Okay? For every vaccines that you will encounter, ito po yung common na tanong, especially for Group A1 ngayon na healthcare workers ang ating focus for immunization. About fear for the possible, baka magka-dengue scares naman tayo. So, ano nangyari kay Dengvaxia for the dengue virus prevention ng infection is, according sa studies nila, conducted evaluation that these individuals developed the antibody-dependent enhancement. But in terms of the COVID-19 vaccine, hindi ho ito na-identify. So, the ADE is only seen for Dengvaxia, and it is not encountered in COVID-19 vaccines. Okay? For the studies conducted for these different vaccines for COVID. Why? Kasi technically, magkaiba ho talaga ang kanilang viruses. And then kung ano po yung kanyang mode of transmission, and then saan ho ba yung target ng infection na to. Ang dengue is more on the ating body system, like your liver. It affects your liver. But your COVID-19 particularly in your respiratory system. Okay, so napakaiba po. Different po yung kanilang platforms. Okay, what if don't get side effect? Does it mean the vaccine didn't work? Hindi ho. So, hindi ho yung totoo. Because there are, based on the current trials, no side effects occurred at varying rates. So, wide range po, only about 1 to 20 of every 100 had fever. But efficiency, no more than 90% for over 100 people. So, ibig sabihin, hindi ho ibig sabihin na hindi ho kayo naka-experience ng reactogenicity or immune response, hindi ho tumalab sa inyo yung bakuna. Hindi po noon. May mga tao talaga ho na walang nararamdaman, but their body is already responding to your current problem or the exposure to the vaccine. So for those who have received a vaccine other than the COVID-19 vaccine, at least 14 days po yung interval bago nyo bigyan ng COVID-19 vaccine. For example, binigyan nyo siya ng pneumococcal, like for this example, no? Give 14 days interval prior administering the COVID-19 vaccine. Okay? And for those yung mga unvaccinated individuals na sa household at meron kayong kasama na na-vaccinate, hindi ho yun kailangan na mag-cause ng risk sa mga household members nyo. Kung may nagbakuna po na healthcare worker at na umuwi ho sa pamilya niya, hindi ibig sabihin na mahawaan niya yung family niya. Hindi po. It's only a protection from you and it will not be spread to your family. So, is it okay to give different types of COVID vaccines? Hindi po. Kayo nga, so what I have said, hindi po interchangeable yung ang isang brand sa isa naman po. Kaya ngayon, gusto nyo mag-Sinovac. Since next week, meron pong AstraZeneca, yun ang gusto nyo second dose. Hindi po. Kahit ano po pong dumating na bakuna, no, kung ano po yung naibigay sa inyo, yun po rin po yung tatapusin nyo na vaccine. Kung 2 doses po si Sinovac, 2 doses po ang ibibigay sa inyo na Sinovac. Okay? Naintindihan po, wala pa po tayong WHO recommending na you should be given with different brands or different forms of vaccine. Special population, na-mention ko na po yung iba dito kanina. So, can person with immunocompromised state get vaccinated? Yes. So, may mga circumstances lang na contraindicated. No, kung meron kayong ganito, severe allergy from the component na document na talagang allergic kayo doon, so hindi po kayo pwedeng bigyan. Provided, syempre, immunocompromised kayo. Yun lang naman po yung contraindication, major contraindication po yun. Can person with immunocompromised gets the vaccination? Yes, yun po, as what I have said, kung contraindicated po kayo doon. And kahit siyempre, ang cancer patient, immunocompromised. So, they can still receive, provided they are being cleared from their attending physician na pwede sila, no? And ang contraindication lang po is doon sila sa may allergic reaction po sa component, any component of the vaccine. So, can a person receiving steroids receive the COVID-19 vaccine? In general, yes. High doses of steroids may reduce person's response to vaccine. So, you need to discuss this with your attending physician kung papayagan nyo kayo. Kasi nga, it will also suppress your immune response. So, instead of your waiting for more production of your antibody, baka yung 100%, hindi na 100%, pwede mag 75-50% because of the immune suppression side effect of these steroids. So, kailangan nyo po i-discuss yan with your attending physician. Transplant is the same, but there are some conditions, okay? Yes, transplant recipient may receive the COVID-19 vaccine if they do not have severe or immediate allergic reaction to any component of the vaccine. They should undergo individual assessment. Yes, they need to be cleared by their attending physician. So timing is not yet defined, okay? So ang recommendation is the candidate should be vaccinated prior the transplant and it should complete 2 weeks, okay? Kaya magta-transplant siya 2 weeks from now. Dapat ngayon pala bigay mo na kasi dapat meron kang interval na 2 weeks. So prior the transplant. So yung mga inactivated vaccine recommends at least 2 weeks prior to transplantation like your Sinovac. Or starting at 3 to 6 months after transplantation. So ito po yung mga conditions. Take note of this. Baka may mga kamag-anak po kayo na may ganitong mga suliranin, no? Problem. So pag inactivated, 2 weeks prior transplant, or kung hindi na humahintay kasi kailangan na mag-transplant, 3 to 6 months after transplant. If only one dose vaccine is received before the transplantation, the optimal timing of the second dose is not yet established. So anong option natin? So ang opinion po is administering the second dose at least 4 weeks after the transplant in order to allow time to decrease the immunosuppression. Kasi marami pong bibigay ng mga drugs like steroids, antibiotics, antiviral. So marami tayong i-consider. So meron kayong at least 4 weeks, 1 month preparation. Okay? If the transplant recipient has any acute illness, definitely kahit healthy individual ho yan, biglang nilagnat during the day of vaccination, i-delay nyo po yun. And those who are receiving active treatment for acute graft rejection, so kailangan pong i-delay kasi it will add burden to your patient. So this is based on the statement given by the society or the Philippine Society of Microbiology and Infectious Diseases, February 12, 2021. So, can a person with autoimmune? Yes, unless contraindicated sila sa allergy, content, no? Yung Guillain-Barré and other problems, autoimmune GBS, so kailangan lang po natin i-declare yan and you would ask your clearance from your doctor, from your attending physician prior receiving this. And then as well as kung contraindicated po sila, may allergy sila sa component ng bakuna na yun, contraindicated po sila. Pero kung wala naman po, they need to have their clearance, they need to outweigh the risk for the receiving the vaccines. So can a person who give other types of passive antibody treatment receive the COVID-19 vaccine? Yes, unless contraindicated. So person receiving antibody therapies, not specific for COVID-19 treatment like your immunoglobulin, yung mga anti-rabies natin, no? Administration of the mRNA, for example, is any interval should be needed, okay? Interval before or after receiving the antibody containing the product, no? Usually, ang advice nila is 2 weeks ang interval. But there is no recommended minimum interval. Particularly for the mRNA. I'm speaking for the Pfizer product and Moderna product. So, ang kanila is you need an interval, no? Ang suggestion nila is 14 days. Can a person living with HIV, ito yung sinasabi ko sa inyo, may cut-off tayo. Pwede ho silang bigyan, but depende po sa kanilang health status, immune status nila. If they have a CD4 of more than 200, religiously taking in their ARB, yes, they are qualified. But again, you need to explain to your vaccinee, your patient, no, na even though it is inactivated or non-replicating vector type vaccine, may mga side effect complications. Okay, and they should also declare their past medical history kasi baka naman yung iba nagtatago because of confidentiality issue. So you need to talk to them and need counseling prior giving the vaccine. So you don't need to test the individuals for any, like for RT-PCR and HIV screening bago nyo ibigyan ng COVID-19 vaccine, hindi po yan protocol. Hindi po siya standard. So, you don't need to test them prior vaccine administration. But please instruct your vaccinee to declare their health status. No? Kung may mga min-maintain ba sila, ano ba mga conditions nila, for you to know and for you to decide and advise what need to do. Okay, so HIV individuals, if they are not having a severe allergic reaction to any component, they can be vaccinated. Those who are using anticoagulants, pwede po, but in precaution, babantayan ho natin sila. And again, clearance from your attending physician. And meron po silang advice na needle na gagamitin. So, what we're using for Sinovac is 23, gauge 23 po. And then we will monitor them, definitely. 30 minutes to 1 hour post-vaccination. So, patient with comorbidities, they can be given, okay, unless contraindicated sila sa component ng bakuna. Who have chronic illness or chronic infection? Yes, pwede. Lalo na may TB. Okay, yung may natitreat. O, kailangan continuous pa rin po yung pagbibigay ng gamot sa kanila. Okay? Persons who are having treated for chronic infection like TB can be vaccinated and must continue taking their medications. Person who will come to vaccination facilities with an acute fever currently treating acute infections, or i-delay po natin. Okay? Kailangan po wala ho silang current infection. Management, ito na po. Those who are being assigned for the vaccination site, baka meron ho ma-assign sa atin because we have attendees of doctors, plenty of doctors. Management of acute event, adverse events following immunization. Okay? So, we need to define these are the untoward medical occurrence following immunization, which is not necessarily brought by the vaccine. Okay? So, we have different types. You have the serious, minor, and cluster. So, we need to report this. So, kaya po may mga doctors po na nandoon sa vaccination, post-vaccination site. No, importante po. So, they could classify and then they could give immediate management for these individuals who will assess as serious, assess as minor, or kung meron bang nagugrupo ng mga symptoms na ito. Special interest po, especially for those with comorbids. Kailangan pong babantayan natin. Okay, adverse event of special interest. So, hindi pa po sila nagbabakuna but they already declared their medical condition. So, once they are able to receive the vaccine, kung candidate po sila, ihintayin natin, babakunahan natin sila, hintayin natin sila sa post-vaccination at bantayan. Golden period is 30 minutes to 1 hour for evaluation monitoring of these individuals. These are the time scale that you need to monitor from early warnings to life-threatening. So, kailangan po ma-recognize natin ito and then instruct our vaccinee to declare anything kung ano pong nararamdaman nila. Okay? Sometimes, after the vaccination, sa bahay pa nila nararamdaman, they need to be instructed what to do. Okay? For these moderate to severe symptoms, signs and symptoms need to be admitted immediately and management should be given immediately. So these are the way nice to know lang po, ganito po paano tayo mag-response in terms of the AFI. These are the standard consent for either Sinovac or AstraZeneca. Consent form, kailangan po yan prior receiving the vaccination. And this is how we risk assess the individuals who will can be given with the vaccination. And for those moderate and high risk, X na ho sila. For the low risk, pwede ho sila mag-proceed for the vaccination. So this is the standard assessment tool for Astra and Sinovac. So ito po, some of the doctors already saw this. Paano ho natin ito ginagamit during the screening for the vaccinee. And this is the way we approach for the vaccination during the observation for post-vaccination events, no? So if it's mild, we treat them immediately and give them proper management like giving antihistamine. But for those who are not resolving, nagpupursige po yung symptoms nila, like for example, biglang nahirapan huminga, okay, nahimatay, umaakyat ho yung BP or bumabagsak ho yung BP, nagsusuka, nagtae bigla while nasa facility, we need to assess them immediately and give the proper management. And then we will decide kung i-admit o hindi. Definitely for those who are not resolving, admit. Okay? And these are the checklists that you need to check during your vaccination or duties, no, doon sa ating vaccination site. Ito po, emergency kit natin and other materials that you need to need to be in your emergency kit. So once you're able to notify or identify that there is a ongoing side effects, no, na kailangan ng medical management like for mild allergic reaction, urticaria or rhinitis, you can give them oral antihistamine, or if you're recognizing that it will be an impending anaphylaxis will come, so you need to treat them immediately with the epinephrine. Okay? And this is a important measures that you need to give an instruction for those vaccinees before they left to the vaccination facility. So kailangan ho i-orient nyo na kailangan ma-prepare sila post-vaccinee and they know what to do step by step and whom to contact, kung sino ba nang pwede nilang matawagan regarding their reactions na immediately mabigyan sila ng attention. So you can also instruct them how to reduce the pain and discomfort and how what other measures they can do while they are in their homes, no? And they need to instruct kung sino ba, bigyan sila ng instructions, no? Guide instructions what to do. And for those who have cough, shortness of breath, or sore throat, or any problem pointing into a possible COVID-19 infection, they need to be tested. They need to be reported, no? Kasi baka nagkaroon sila ng concomitant exposure while baka doon sa during vaccination or prior vaccination. So this is the standard vaccination card. Some of the CRMC personnel already received this. So nakalagay ho dito, tingnan natin, no, yung second dose schedule, no? Kung kayo po ay binigyan nung March 5 or March 8 na vaccine or March 9, nag-receive po kayo after 28 days. Okay? For example, sa mga March 8 po na in-inject, April 5 po sila babalik for their second dose. So, kailangan po natin i-complete. Meron po silang ID number. So, this is the standard preparation for vaccination site. This will be furtherly elaborated later. So, ang standard lang po, kailangan po may waiting area, may entrance, one-way traffic. Hindi po mag-cross over yung other vaccinees to the other vaccinee. Proper vaccination site, may exit sila, and then nandito po yung kailangan po merong post-vaccination monitoring area. Importante po ito for us to know kung may mga adverse events following immunization. So ang golden time natin is 30 minutes to 1 hour. So the flow, we made a general flow for our medical staff, no? Or working at the CRMC kung may mga adverse events po following immunization. So ito po yung susundan natin. And then same with these two is once they are assessed as to be admitted, they need to undergo screening po. Para po malaman natin kung wala pong may dala ng SARS-CoV-2, no? So we could properly assign their respective wards. So meron ho for the wards ng ating staff sa ONCO ground. Then yung isa naman po is nasa pay ward. So whatever the result from their screening, doon po nakadepende kung i-isolate natin sila or they will stay on those respected wards, no? And then we will manage them. So importante po, alam nila kung saan ho sila tatawag, sino pong lalapitan, and what flow they will follow. So for all of these measures that we're doing, no, this is a Swiss cheese respiratory representation on how do we prevent the spread of this infection. So it is not enough that we will just do physical distancing, wearing the mask, and hygiene, no? And preparation with the quarantine facility, yung government support, financial support. We cannot do this alone. But if you're going to add this up, plus you will subject yourself for vaccination, the infection will be furtherly prevented. And each individual, especially the vulnerable population, will be protected, no, not to acquire this infection. And each intervention has an imperfection host, as you can see here. But if you're going to add this up, as well giving receiving the vaccine, the multiple layers improve the success and recognizing that no single intervention is perfect. They need to be intertwined to one another in order to prevent the spread of this pandemic. And remember this, the 3 W's plus the letter V: wear, wash, watch, and be inoculated with the vaccine. We can all prevent the spread of this pandemic, the COVID-19 infection. And before I end, I would like to acknowledge these individuals who are part of the preparation of the slides I shared to you. They allow me to share to you, my consultants from the different hospitals. So my colleagues from PSMID, the team of Adult Immunization Committee. Okay, so they allow me to share to you the slides, for us to more understand what COVID-19 vaccines are. How is it important to us, So this is the question. COVID-19 vaccines, are we ready? Either Sinovac and Astra? So the answer is yes. We need to ready ourselves. Okay, we need to prepare and we need to do something in order to prevent this spread of infection. And with all that, I will leave you this from COVID-19 Tracker Organization. Vaccines don't cure diseases, but prevent them. So thank you, and thank you all for listening, and thank you again for inviting me to share to you my knowledge regarding the vaccine. And I hope I'm able to convince you to be vaccinated in the coming days. This is not only for me, but as well for our family, for you who are healthcare workers, giving support and management for these individuals who are affected with this infection. And for that, thank you again. Thank you, ma'am, for conducting this webinar. Thank you very much.
Thank you, Doctora, for that very informative discussion. I hope our participants who have not received their vaccines yet will be ready in the future. So we will from the participants. We actually have several questions, pero po yung time natin. So Ma'am Antonetta Lu's question, if the vaccine is safe for cancer patients and for patients with allergies, I think that was answered earlier. We have a question from Ma'am Karina De Barosan. Unknowingly, a certain COVID positive patient got vaccinated. Are there any adverse effects?
Come again.
From Ma'am Karina De Barosan, unknowingly, a certain COVID positive patient got vaccinated. Are there any adverse effects? If positive daw po yung patient unknowingly.
So he or she doesn't declare her status, no? Yun ang problema natin pag hindi siya nag-declare. Pero in terms of untoward events, the only thing that we could tell na meron siyang magiging reaction is the reactogenicity, yung pain. Definitely. But in terms of adding on the burden for being infected, wala po. So wala ho namang mga studies na gano'n.
Okay. Okay. Another question po, Doctor, is from Ma'am Jocelyn Mojado. If mag-RT-PCR after vaccination, will it give a positive result?
again, the COVID vaccine doesn't cause infection. Okay, so and it is also not advisable unless you have symptoms of COVID-19 after receiving, no? Kagaya ng sinabi ko kanina, kung may mga complaints ng cough, colds that points to a possible infection, so that's the time we could test for RT-PCR, but not necessarily, not a causal effect from receiving the vaccine. Baka prior pa nang nag-vaccine, na-expose na siya. Because mind you, we're not testing RT-PCR prior or any rapid antigen or rapid test prior the vaccination. So baka while having o bago pa siya makapunta sa vaccination site, infected na siya. So yun yung mga circumstances na hindi natin tawag dito, ma-prevent, no? But kaya nga po during the vaccination day na naka-schedule kayo, we're instructing each and everyone to wear their mask, to wear their face shields, and observe physical distancing. Kaya po sa vaccination site, meron po tayo na standard floor plan para ho masunod and we could prevent transmission of infection. Kasi we'll never know kasi kung sino talaga yung nagdadala. Hindi naman ho tayo nag-i-screen ng laboratory diagnostics, no? Prior the vaccination day.
Noted po, Doctora. Doctora, for other questions raised by CRMC employees, can we just personally send you a message kasi wala na po tayong time. So if we have no further
answered the
questions.
queries, mga common queries already.
Opo, Doctora. So allow me to present our certificate of appreciation. Ayan, yung certificate natin. Allow me to our certificate of appreciation to Dr. Narain Pendongkansi, MD, FPCP, DPS, MID, in grateful recognition and sincere appreciation for sharing our invaluable time and expertise as speaker with the topic Bakuna sa COVID-19 ating alamin, updates on COVID-19 and insights on its vaccination, given this 12th day of March 2021, signed by the Chairman Dr. Hanifa Sarosong and Dr. Rosny Sabido Coronado. Thank you po, Doctora.
Thank you, Dean.
So for our next speaker, to give us an overview of the COVID-19 pandemic and the updates on its status worldwide, may we call on Dr. Hazel Kalingasan to introduce our next guest speaker. Dr. Hayes.
Good evening, everyone. So it is my pleasure to introduce to you our second speaker. She's a graduate of Bachelor of Science in Nursing at Notre Dame University here in Cotabato City. She's a candidate of Master of Arts in Nursing and a graduate of Masters in Public Administration. Currently, she is a infection control nurse of the Cotabato Regional and Medical Center from 2008 up to present. She had several trainings on infection prevention and control and a DOH nurse certified level 4 infectious disease nurse with HIV and AIDS counseling. Next slide, please. She had several trainings, particularly on nosocomial prevention and control at International Medical Center of Japan, basic infection prevention and control at St. Luke's Medical Center and PGH. She had a training on trainers on ERID at IRTM. And currently, and she had several recognitions from 2019 as a best infection control nurse by Philippine Hospital Association. And recently, she was awarded with a Gawad Bayaning Kalusugan with a second placer from the Philippine Chamber of Commerce and Industry. Ladies and gentlemen, I am proud to introduce to you our beloved infection control nurse, Miss Sheher San Ibrahim.
Okay. Wrap ako. Good evening. I'd like to share my slides. Parang nasa 11 na siya. Wait lang. So good evening. It is my pleasure and I'm honored to be your speaker for this evening. I know this is very timely for all of us and I believe we all have a role in dealing with the pandemic. My task or I am tasked to present to you a lecture on the updates of the COVID-19. Basically, I focus on the response of the Philippines now that the vaccine is with us. Um, Actually, my presentation would be easier because we've heard of Dr. Kansi's lecture already. So I'll focus more on the present situation of our country and even of our locality wherein we are now on the phase one of the COVID-19 deployment program. So the contents of my presentation would be the introduction, the prioritization criteria of how the vaccines are being prioritized, the zoning allocation, the preparation of the quick substitution, master listing, microponding, the logistics, storage and handling, the training of healthcare workers, the vaccine process, adverse event following immunization and referrals, data and record management. So, as an introduction, the COVID 19 disease is caused by a novel coronavirus or the SARS CoV 2. This virus mainly is transmitted from person to person, like through droplet contact and fomites. So, it is transmitted when a person coughs, sneezes, or exhales, producing droplet of saliva containing the COVID 19 virus. So that's why, and also COVID-19 primarily affects the lungs, but can also affect the organs. So you you will see a person with COVID-19 with the following symptoms. So you will be noticing them having a fever, cough, sore throat, shortness of breath, fatigue, headache, sudden loss of taste and smell, running, stuffy nose, nausea, and vomiting, and also diarrhea. However, there are some group of individuals who will actually manifest no they will be asymptomatic, but still they have the virus. So usually symptoms may appear 2 to 14 days after exposure to the virus. So with the presence of vaccine that we are deploying now, still, we are not supposed to lower our guards. We should be reminded the 9 important COVID-19 prevention measures. So the approach to the prevention and control of COVID-19 does not only rely on one strategy. So we have to be reminded that even with a vaccine, we still have to stay home and self-isolate. If you feel unwell, even with mild symptoms, we have to clean our hands frequently and then cover our nose and mouth or practice the respiratory hygiene etiquette. We have to avoid touching our nose and mouth, maintain a minimum physical distance of at least 1 to 2 meters, and then stay away from crowds. Use fabric mask or you can use the medical and surgical mask. And of course, regularly clean and disinfect because the virus can be transmitted through contact precautions. So the deployment of the vaccination of vaccines in our country is actually stated in the omnibus guidelines by the DOH Department Memorandum Order 2021-00099. So this deployment is very useful to us as we deploy the vaccine because we have seen the different variants of this COVID-19 virus. In fact, there are already additional six variant of B1351 of a South African variant, three additional V117 of the UK variant cases, and additional two cases with mutations of interest among the 8 batch of 350 samples sequenced by the UP Philippine Genome Center and then the UP National Institute of Health. So this data will show us that we really have to work fast because the virus is mutating also faster. In fact, in the data of the WHO, the reported cases of COVID-19 reaches now to 117,799,584. The total number of deaths is actually 2,615,018. And as of the WHO data, with the deployment of the vaccine, COVID-19 vaccine, we have already, as of March 9, we have already administered 300,022,228 vaccines. So this is a world data that was taken last March 9. So in the Philippines, we have actually 648 confirmed cases. 12,600 of them are already died already, and then there are actually about more than 500,000 recovered with active cases of 47,769. This was the data from March 11 and taken from the DOH COVID-19 tracker. So with the current increase in the number of cases, we really have to encourage everyone to accept the vaccine as a way of preventing the development of more variants because the virus is really mutating fast. So in the department memorandum order, it was stated there the prioritization criteria. As you have noticed that as of now we are in the phase 1 of the implementation. We will know what phase 1 is because in the memorandum, the three phases, or when the expected vaccine supply, would be divided into these three phases. Phase 1 would be the vaccine shall be given to the potentially limited supply of COVID, concentrating efforts on critical population wherein the basis would be on the risk of exposure and mortality. So if you have noticed, the phase 1, it addresses the frontliners. So sino ang binibigyan? Tayo pong mga healthcare workers, basically those who are in the hospitals who are catering for COVID-19. The phase 2 would be the large number of vaccine doses available would be given to ensure access for the general population, particularly to working population. And the phase 3 would be sufficient supply of vaccine doses for the entire population, wherein ensuring equitable access to all population, monitoring uptake and coverage, re-strategizing to increase uptake in population with low coverage. So ano yung nasa phase 1? In the phase 1, the priority eligibles, this was already mentioned, were the A1 group, the A2 group. The A1 group are the frontliners, both national and local, private and public health professionals, and non-professionals like students in health and allied professions courses with clinical responsibilities, nursing aides, janitors, barangay health workers, because they are in direct contact with the possible COVID cases. A2 would be for the group of senior citizens aged 60 years old and above, while the group A3 are adults with comorbidities not otherwise included in the preceding categories. So hindi sila healthcare workers. The A4 group are the frontline personnel in essential sectors, both in public and private sectors, including uniformed personnel and those in working sectors identified by the IATF that are directly client-facing and cannot dutifully meet minimum public health standards. So sila yung mga men in uniform natin. While the A5 are the poor population based on National Household Targeting System for Poverty Reduction. So sila yung mga indigent individual, not otherwise included in the preceding categories. So the phase two, because now we are in the phase two, the priority eligibles would be the group B1 would be the teachers and social workers. The group B2 would be the government workers. The group B3 would be the essential workers. The group B4 would be those with socio-demographic groups at a significant higher risk other than the senior citizens and poor population based on the NHTS and then the B5 is those with institutional workers and those engaged will be as remaining workers. On the other hand, the phase three priority eligible are rest of the Filipino population not otherwise included in the two phases groups. So sila po, meaning to say the whole of the Filipinos will now be given with the vaccine. But now we are still on the phase one. In the zoning allocation, so process for vaccines with sensitive handling because this strategy must be applied because of the limited numbers of vaccine. Hindi lahat, buong mundo kailangan po ng vaccine. So kailangan mag-strategize kung paano natin may bigay sa lahat yung vaccines, even if we have identified the groups. So the zoning allocation is actually a geographic based on the geographic zone. Usually, it is the Center of Health and Development, as in our case, and the MOH BARM, who determines the appropriate zoning. So in our locality, we were one of the first to receive the vaccines. So each zone shall develop microplans. Before we are to receive the vaccines, we have to develop microplans. So each health facility, LGU or institution shall submit attestation of the total number of potential vaccine to the CHD. That's why we cannot be accommodating individuals or healthcare workers who are not actually working in our community or in our institution because before it was given to us, we were able to submit the total number of potential vaccines of our institutions. To further discuss on the vaccination deployment, there is such thing as preparation of quick substitution list. So, in the quick substitution list, this is to minimize vaccine wastage because we have submitted the eligible population or eligible vaccinees. There are times that these eligible vaccinees will not be able to avail of the vaccine for a valid reason. So these shall not include eligible recipients from vaccination site, which are included in the allocation list of the current batch for vaccines. So dahil hindi nakunan yung nakasulat sa master list natin, then we will have a substitution list. So the no patient in active disease or with COVID-19 symptoms shall be given or shall be included. So because the guidelines tells us that if you have a COVID-19 symptoms or if you are an active COVID-19, then you should not be receiving the vaccines. So the next would be the master listing. In the master listing, the Vaccine Information Management System Immunization Registry actually received the data that were sent to the DOH. They are the one who is responsible for the master listing and the registration of all the vaccinees. It is the official platform for master listing and registration. So once you enter the vaccination site, you will be asked by the registration station to present datas or IDs, identification cards, so that they can validate in the VIMS master list your names if you are included in the pre-registration process. So in the master listing, the DOH-CHD consolidates a list of eligible potential vaccine recipients. However, you shouldn't worry because a compliance to Data Privacy Act in processing personal information is ensured. That all health facilities and LGU shall submit required data to provide highly urbanized cities independent components. Every institution submitted their data to the BIMS, no? So after the master listing, we now go to the micro planning. In the micro planning, this is conducted by the local government units and the implementing units. An example of these implementing units is our institution or the CRMC. A readiness assessment tool shall be used to assess and monitor the implementation of the plan and determine and address the identified issues and the gaps. So before the rollout of the vaccination, a micro-planning was done and we were assessed by the Center for Health Disease or the CHD-12 so that if we are able to manage the rollout of the vaccination. So in the micro-planning, these are the critical steps that we have to follow. We have determined the eligible population, identify implementing department units in the facilities, and designate the vaccination team, which composed of supervisors, AFI, composite teams, and other personnel needed in available vaccination activity. So in the rollout of the vaccination program of COVID-19, if you have noticed, we have groups. In every station, we have assigned individuals who actually man the station so that it will ensure us an effective and efficient flow of the vaccination process. Another critical step is that we identify vaccination team based on eligible population, listing of vaccination posts, and including non-health facilities. So if you have declared that this is the vaccination site of your institution, then it should be monitored and it should be listed. The assignment of potential vaccine recipients, assessment of cold chain, and estimation of eligible populations. These are all part of the micro planning, which is essential in the effective rollout of the vaccination program. Estimation of the vaccine requirement, timely delivery of vaccines, and of course, training of human resource. All implementing institutions must train their human resource before the deployment or before the rollout of the vaccination. Because in every vaccine, there are separate way of handling it. And I think it was shown already that a Sinovac is differently handled with the AstraZeneca. So it needs a training for the human resource so that the vaccine will be effectively and efficiently administered to all the vaccinees. So there is also a preparation of a daily vaccination session plan, a development of a communication plan, and a development of for facility and community advocacy, social mobilization, and partnership and engagement. In the effective implementation of this program, we need to work with the local government unit as well as the CHD because our institution cannot do it alone. We need to work with them because they are part of the rollout of the vaccination. Preparation of an AAFI or AASI management and surveillance and response plan and the development of the waste management plan. So there are times that the vaccinees will develop an adverse event following immunization. And in this way, it has to be handled properly and it has to be addressed immediately so that the safety of our vaccinees will be ensured. The next would be the logistics, storage, and handling. Before the vaccine can be given or can be issued to the implementing institution, it should be assured it should be ensured that we have enough logistic, we have the proper storage, and we know how to handle it. So we shall follow the Department Memorandum Order number 2021-0053 or the interim guidelines of the shipment and acceptance of the COVID-19 vaccines and ancillary immunization commodities, wherein it emphasizes the cold chain management maintenance. In our case, wherein we were able to receive the Sinovac or the AstraZeneca, we only need to put or store the vaccines in a refrigerator with which can maintain about 2 degrees to 8 degrees Celsius temperature. So in the training of the healthcare worker, which is essential in the effective implementation of the COVID-19 vaccination program, it is essential that before they start the rollout, everybody must be trained. So usually the regional vaccine operations center conducts the training, and then this training must be cascaded to the implementing units, and then some institution can do the simulation exercises before the actual rollout of the vaccines. In the vaccination process, if you have noticed in our vaccination site, we have applied these procedures. There is a pre-vaccination wherein we look at the eligible population and then the scheduling of those potential vaccinees, and then there is the registration. Another process would be the screening. In the screening, it is where you will assess the potential vaccinees or the vaccinees, and if they manifest or if they have the following conditions, they must be deferred. So one would be those manifesting flu-like symptoms. And then another one is those with history of exposure to confirmed or suspected COVID-19 in the past 2 weeks, and those with confirmed COVID-19 patients, person who received convalescent plasma or monoclonal antibodies, and a pregnant person, usually first trimester, but there are some uh, vaccines who actually discourage a pregnant vaccinee. Person who received other types of vaccines in the past 2 weeks. So if and when you have received, for example, a flu vaccine, then it should be that you can receive the COVID-19 vaccine after 2 weeks. So another condition wherein a vaccinee can be deferred would be those who have immunocompromised, person with autoimmune disease in remission, and person living with HIV with a CD4 count low or is in treatment, and then cancer or malignancy. Another condition with those undergoing transplant who uses steroids, or those elderly bedridden in the case of the Sinovac. It is not given to individuals who are 60 years old and above, or those who are bedridden, vegetative state with poor prognosis, or those with limited life expectancy of less than 6 months. However, there are also additional precautions. Those with history of bleeding, or those with previous history of anaphylaxis with allergies to egg, medicine, and persons and experiencing asthma. Persons who do not meet the criteria, and persons under the following categories: those who are breastfeeding and those persons who receive immune globulins. So part of the procedures or the process also is health education. Usually, this is conducted in the counseling station of the vaccination site. It is where a counselor or an educator stays and then explains the benefits of the vaccination. There is also a video explainer, instructions at post-vaccination area, and those in providing additional IEC materials, and of course, the available forms. These are part of the health education of the vaccinees. So patients shall follow after the educating, or after a patient undergoes or consented for the vaccination, comes the vaccine administration. So there is a process flow, and then only licensed physician or nurses may be vaccinators. So usually, if if it's in a hospital, uh, the vaccinators are usually are nurses and they are already licensed. Vaccines shall be drawn up in a designated clean up medication area, and then vials shall be disposed following set protocols, because there is the vials are returned to the Center for Health Disease. The empty vials are actually counted every after vaccination period. After vaccination, the vaccine recipient shall be observed for adverse events, and they shall be placed in a post-vaccination area. So vaccine recipient must be informed of specific facility, hotlines, and contact numbers for follow-up. So in the health education process, the vaccinee are actually instructed and given with the forms or the instruction of whom to call, when to call, where to go, if and when they experience any signs and symptoms. Standard vaccination card are also given, and also electronic vaccination records shall be made available. That's why if you can see in all the vaccination site, mostly for those who are capable, have a station computers in the registration area, and those who experience AFI during the post-monitoring shall immediately be brought to the designated health facilities. AEFI monitoring shall also be done up to 1 year from the date of vaccination. Vaccine recipients shall be reminded of their second dose vaccination schedule. So after the vaccine administration, the, the vaccinator usually explains the vaccinee of when is the next schedule. Aside from that, it is also re-emphasizing the post-vaccination station or area of when is the next after 30 minutes of monitoring and then they are discharged. The vaccinee are explained of when is the next uh, vaccination schedule. So now we go with the adverse event following immunization and referral. An example of this is the CRMC is actually designated as the referral center for the adverse event following immunization in the region, one of the referral center. So before the deployment or before the rollout of the vaccination program, we have already identified rooms or areas where we can place individuals or vaccinees who develop adverse event following immunizations. So we also receive referrals from the community. So non-serious, the AFI are actually classified into one, non-serious AFI or minor AFI that are not included or categorized as serious AFI or do not pose a potential risk to health of the recipient, like those experiencing pain, swelling, and redness. While serious AFI results in any of the following outcomes: death, hospitalization, prolongation of an existing and persistent or significant disability or incapacity, congenital anomaly, or event that may be life-threatening, a medically important event or reaction. While an adverse event of special interest is a pre-specified medically significant event that has the potential to be causally associated with a vaccine product that needs to be carefully monitored and confirmed by further studies. So the vaccination site shall ensure that proper and appropriate guidance is communicated to and understood by each vaccine recipient. So we have to ensure that the vaccinee have understood all the instructions and must be able to communicate with that, and then self-provide corresponding assistance to vaccine recipient experiencing AFI. That's why some institutions have deployed also the responders to immediately respond to those individuals who has an AFI. So the local vaccination operation center shall ensure functionality of an AFI investigation team. Usually the DOHCHD actually visited the the vaccination site to ensure that the process or the procedures in the deployment program are actually complied. So the national and regional AFI committee shall determine the final causality assessment when the local vaccination shall ensure functionality of an AFI investigation team. And data information generated from the AFI monitoring system and recommendation shall be utilized in the CQI of the immunizations. So it can actually be used sometimes in research. So next is the data and record management. So with the data that we have, the VIMS develop and maintain the ICT main platform for vaccine-related interventions for immunization, supply chain, and logistic management. So in our daily activities, especially in the deployment or implementation of the COVID-19 vaccination program, we are making a report to directly to VIMS, no? So the data and record management could be through the COVID-19 Bakuna Center Registry, which is important in coordinating with the third-party logistic, or the vaccination quick count. We give reports at around twice a day. So merong report at 11 o'clock and at 6 o'clock. So in the vaccination quick count dashboard, it visualizes critical indicators from the vaccination site on a daily basis and shall provide vaccination operation center with timely data. So they will be able to know how many are vaccinated, how many are deferred, how many refused, how many vaccination sites have AFI, how many vaccination sites have problems on logistics, and so on and so forth. So those are the informations related to the implementation of the program. The reason why we've chosen this uh, lecture is to let you understand what is our government's deployment program, and for us to really encourage our fellow healthcare workers to really comply with the vaccination program, because it is an opportunity for us to really help in the control of COVID-19 and eventually receive or be able to achieve the herd immunity. So I think I have finished my presentation. I'd like to end you with the saying that though the vaccine is not a cure for the COVID-19, but it can help us prevent the increase on the development of more variants. So I'd like to end you with the verse in the Al-Bukhari, which states that there is no disease that Allah has created except that He has also created its treatment. So it may not be the treatment, but it can be the solution to help us prevent and slow down the transmission of COVID-19. So we can be greater than the sum of our parts, for together we can do so much, and together we can beat COVID-19 as we heal as one. Once again, good evening and thank you very much.
Thank you very much, Ma'am Che, for that very informative lecture or discussion. We would like to remind everyone that the certificates of attendance will be sent to you individually through the email address you provided during the registration after you have filled up the post-webinar evaluation. The link will be provided in the chat box or will be sent to your emails. Now to proceed with the open forum, do we have any questions for our guest speaker from the participants? Okay, if we have no further questions for our guests, allow me to present our certificate of appreciation to Mom Sherazad E. Ibrahim, RN, DIPHM, CHA, in grateful recognition and sincere appreciation for sharing your invaluable time and expertise as speaker with the topic Bakuna sa COVID-19, ating alamin, updates on COVID-19 and insights on its vaccination, given this 12th day of March 2021, signed by the Chairman Dr. Hanifa Sarosong and Professor Dr. Rosny Sabido Coronado. Also, we would like to present a certificate of appreciation to Rosny Sabido Coronado, RN, RM, MAN, DM, in grateful recognition and sincere appreciation for sharing your knowledge and expertise as advisor on how to conduct a successful seminar, given this 12th day of March 2021, signed Dr. Hanifa Sarosa. Before we proceed to our closing remarks, may I remind you again of our post-webinar evaluation. You have 3 ways to access the evaluation forms: by directly scanning the QR code flashed on the screen right now, by using the link sent to your email account, or the link posted in the chat box. Before we end the program, may we request our participants to please turn on your cameras for a group photo? Kung pwede po, pa-on po ako ng mga camera. Doc, pasabok na po yung gallery view natin. Naka-on na ba yung camera ng participants?
Naka-zoom kami man. Oh.
Okay, I think we can proceed with the last part of their program. May we call on Dr. Jehan Kashmira Muhammad Kampiao for the closing remarks.
Makita niyo ba ako, Des? Kasi hindi yata nagwo-work yung camera ko.
Yes, Doc. Naririnig po kayo.
Pero wala ang picture, no? Ay, wala
Meron
yung...
po, Doc. Meron po tayong picture.
Ay, yung
Wala
camera.
pong camera, pero
Sira
meron po
yung
tayong magandang picture
camera.
sa PowerPoint.
Okay lang. Sige. Good evening. On behalf of the organizers, I would like to extend my gratitude to our speakers, Dr. Norain Kansi and Ma'am Scheherazade Ibrahim, for their insightful and comprehensive lectures. Thank you, Dr. Rosny Coronado, for overseeing this event, and to all the participants who gave their precious time to join us tonight. To my colleagues and organizers, congratulations for making this event successful. The COVID-19 has had a disruptive impact not just to our community, but globally as well, causing millions of cases and hundreds of thousands of deaths worldwide. People suffered not only physically, but mentally and socioeconomically at the same time. While facing this unprecedented challenge, we have learned how to take the basic measures to save lives and to live a quality life as normally as we can. As long as we adhere to measures like keeping distance, practicing good hand hygiene, keeping away from public places, and wearing masks, we can manage to reduce outbreaks into a manageable level. In light of this, for the past 13 months, we have improved our way of collecting data, research, evidence, and proactive responses. With the breakthrough of science and technology, scientists have developed the COVID-19 vaccine, a vaccine that has been revolutionized. Vaccines will work with your immune system, so it will be ready to fight against the virus. Getting vaccinated may help keep yourself from getting seriously ill and may also protect people around you, particularly people who are at high risk. The combination of being vaccinated and following the COVID-19 related protocols will offer the best protection against COVID-19 virus. Now, we can see the light at the end of the tunnel, and the vaccine is already here. By promoting this breakthrough to the public with proper health education, I believe that we can now turn the tide. The future is in our hands. Go and be vaccinated. Thank you all for your patience and have a pleasant evening.
Thank you, Doctor.
at wala
Tapos
kang
ng group
gagawin,
pic.
baka
po.
maiiwan ka, kapatid.
Thank you, everyone. I hope we have imparted knowledge to you through this webinar. Please don't forget to fill up the evaluation form. Thank you, everyone, for your participation and support in making this webinar a success. Good evening and sayonara.
But the good thing
Mag-group
is you
pic
are
na.
not alone. Okay?
May we request the organizers to stay behind for a group picture. Thank you.
Pwede na siguro natin. Pwede na mag-out yung iba, yung participants. Pwede na po. Thank you.
Please don't forget the evaluation forms.
Thank you.
Thank you everyone for joining.
Thank you. Mag-group pic na.
Wait lang po.
Excited.
Tanong.
Jill, yung mo na kailangan magpa-picture. May picture ka na kanina.
Doc, wait lang, Doc. Meron pang iba, Doc. Doc, wait lang, Doc. Meron pang iba, Doc.
At sasagutin po natin yan.
Gastos masyado.
Okay?
May nag-gold star kanina.
So,
Oo nga. Oo nga. Nakaset siya sa kama na eh. Nakaset siya sa kama na eh.
Oo, may kulambo pa ako.
yun yung sinasabi ko na
Guys, may participants pa tayo hindi pa naka-out. Wait lang.
So,
Uy, pwede ba?
do you have any question?
I-remove ko na lang iba, Doc.
Yes, please.
Okay, kung wala kayong tanong, yung live video po natin sa Zoom, sa Facebook, nandun lang yun, hindi natin i-delete. Pagka meron kayong invite, you can add them there, no? And then, before nyo sila i-add, you inform them na meron kayong grupo na kung saan i-add nyo sila. And pag na-add nyo sila, ipapanood nyo yung video na ito because this is recorded. Okay? So, recorded video to. You can use this to invite your prospects. Okay?
Meron pa ba, Doc?
Kayong tanong, we are done for tonight. I am inviting everyone to join.
Meron pa, ayan.
Yang Al-Nazar.
Tayong team.
Si Sir Al.
Doon yun sa team.
Yan na lang po, Doc. Meron pa.
Hindi daw makapasok si
As Naira, Noy.
Naira Nonoy.
Okay.
Okay, I'll snip.
Andiyan na si Doc Adjor.
Ayan.
Okay. Mamaya ka na sumo.
Sila, Doc Miguel.
Doc, wala
Okay,
akong
good.
dinner. Hi, good evening, guys.
Salamat sa Coke.
Smile.
Salamat sa Coke.
Thank you, RJ. Thank you. Thank you to Ma'am Wa.
Ano dito? Speaker. Nandito pa.
Good evening po, Dr. Coronado.
Ay, ito lang yung picture namin. Nagalista ka. Bye-bye.
Doc, anong oras tayo maghatid ng certificate and...
Uy, friends, pwede yung mag-picture muna tayo. Yung matino naman. Harap naman muna kayo lahat sa screen.
Yung matino.
Doc, wala pa.
Wala ka kasali ha.
Mag-green ka.
Tira video ko.
Ha?
Green yung ano mo. Basta.
Green yung background ko. Dali lang.
Yung mukha mo, nag-green.
Green din. Dali lang. Wait lang. Walang background. O yan, pwede na ba yan?
Ayun. Okay.
Wait lang.
Sige na. Naka-on na po.
Okay,
Doc
one.
RJ, halika. Doc RJ. Sana
I'm
si
here.
RJ. Doc Jahat.
Family picture lang yung sa akin.
Dok, gutom na ako.
Family picture. Sige na. 1, 2, 3. Okay? Kain na po. Salamat.
Okay, pwede na ba yun?
Sige
Teka lang
po.
i-post ko na.
Okay na ba? Thank you, Doc Lawrence. Thank you, Doc Arjon. Doc Arjon.
Thank you, Doc RJ. Thank you sa inyo.
Dok, pa time tayo maghatid ng honorarium at saka ng certificate sa Monday. Doc
Anong
Rohan.
oras ba sila nasa
Ask muna
hospital?
natin sila. Ask muna natin sila, Doc. Kasi baka busy ang Monday eh.
Yes, Doc. Ay, may meeting yata si Ma'am Shek kasi dadating yung Astra.
Meeting ka daw?
Eh.
May orientation sila Ma'am She, tsaka Dokansi para second
Dadating
round
yung
ng
Astra.
vaccination.
Bukas ba?
Sa Monday.
Monday.
Dating yung Astra kasi.
Parang busy ang this week, no? Kasi ang AstraZeneca.
Mm-mm.
So, pwede kaya na ano na lang, i-send na lang natin sa mga office nila.
Maka-picture.
Nga eh. Wednesday kaya.
Anyway, Doc, ang importante lang naman, ikaw, chairman.
Si Ayan.
Ano, Doc Hayes? Doc Hayes, naka-mute ka, Doc Hayes. Wala kaming naririnig.
Sige.
RJ, uwi. RJ, uwi ba si Ma'am She bukas? O nandyan lang din siya? Kasi katabi mo pa siya.
May
Kaya ba?
Ma'am She, uwi po kayo bukas?
Wala. Next week pa ko eh.
Oh, see, nandyan si Ma'am. Okay,
Sige,
salamat
bukas
po.
na lang.
Bukas? Si Doc
Salamat.
Kansi.
Si Doc Kansi, text natin mamaya.
Bakit kailangan ba
Ay, hindi, Doc. Tanong
Baka nasa
natin
clinic
muna
siya.
kay Doc Iba kung nakaprint na siya ng certificate at
Baka
saka
ano.
ng frame niya.
Ay, oo.
Kasi bawala tayo madala certificate.
Kailangan.
Guys?
Panay nga niya po na gratis.
Parang PCCI.
Certificate. Minsan wala pa.
Doc Ice, ready na?
Anong si Doc Lu? Ang magbe-print. Okay lang po ako.
O, Timo, wala tayo madala bukas.
Ay, punta na lang natin si Doc Kansi bukas sa clinic.
Pero, di ba bibili pa tayo ng magandang
Sinong gustong sumama?
papel? Ay, sorry, maiba ko. Ange, pwede daw maghingi ulit ng link. Pwede mo bang i-forward yung link ng post-eval para pwede natin i-forward sa messenger?
Actually, Doc, parang magsisend yata si Ange sa email nila. Magsisend si Ange sa
Okay.
email nila. Isa-isa.
Mag-send ako, Doc, ng email with the evaluation. And then yung mga hindi po attend, isend ko na lang din po yung YouTube na link.
Okay, sige. Salamat,
Sosyalan.
Ange. Sige. Social, may pa YouTube. Bye-bye.
Doc, Monday na lang. Certificate. Kasi wala pa tayo nakaprint pala.
Oo, Monday na lang. Mabilis lang naman din yun. I think kaya na picture sa kanila. Photo op lang na mabilis. Tapos, unless
Opo, Doc.
unless
Kaya naman
may
siguro.
ayaw.
Kailan na lang dito ako?
Opo.